Good morning. Thank you for joining the Association of Black Cardiologists, our first virtual community forum and wellness symposium. My name is Dr. Jackie Ubani. I'm a board-certified electrophysiologist and cardiologist practicing here in Orange County. I, along with my host, Dr. Columbus Bautista, who's an interventional cardiologist at the Kaiser Institution in Moreno Valley and Riverside, will be co-hosting this very interactive session. Thank you all again for joining us. We really appreciate you taking your time out this morning to join us for this interactive session. First of all, I would like to extend a special thanks to our symposium planners, volunteers, and sponsors. So thank you so much, Edwards Life Science Foundation, Amgen, and AstraZeneca. As we all know, programs like this would not be successful without the continued support of all of our partners. But before we begin, I'd like to introduce Dr. Paul Underwood, who will give a brief overview of the Association of Black Cardiologists. He was a past ABC president and is currently the co-chair of ABC. And after Dr. Underwood, we have a special guest for you guys, our celebrity and actor and community health advocate, Mr. Lamman Rucker, who will also follow with some words about this program. So without further ado, I present Dr. Paul Underwood.
Great, thank you very, very much, Dr. Ubani. It's certainly a pleasure to be here. And on behalf of the Association of Black Cardiologists and the executive director, the executive leadership, and the board of directors, we would like to extend a very, very warm welcome to you and the rest of the Orange County community for this second Spirit of the Heart Community Forum and Wellness Symposium. Over the next few minutes, I'd like to briefly introduce you to the Association of Black Cardiologists to let you know who we are and specifically provide a call to action so that you can see how you might be able to fit in to protect the health of you, yourself, the family, and those that live around you from cardiovascular disease, and understand reasons why you might want to consider participating and continue supporting the Association of Black Cardiologists and our mission. Many of you may be aware of the association. We've been here for about 46 years, and our mission is to promote the prevention and treatment of cardiovascular disease, including strokes, in Blacks and underrepresented minorities, while we achieve health equity through the elimination of cardiovascular disparities. We have cornerstones. The three cornerstones that we operate on are that of advocacy, both for yourself as a patient and to achieve optimal health, as well as advocacy to inform legislators about some of the changes in healthcare that are impacting our community. We strongly believe in education, both community education for events like today's, and also professional education through our continuing medical education. And as a group of physicians dedicated to combating and eradicating cardiovascular disease, we believe in research and science to make sure that our findings are in the public domain. To support these cornerstones, we have our committees. And certainly our major committees are those of advocacy, medical education, community programs, membership, and research. And what I'd like to do for the next couple of minutes is just to show you some of the activities in each of those realms. Our advocacy committee is committed to removing barriers to existing technologies in treating cardiovascular disease and stroke, while improving access and adherence to current therapies, increasing enrollment of minority participation in clinical trials, and fostering a diverse healthcare workforce, while ensuring availability and affordability of healthcare coverage. Some of our recent themes have been centered around COVID-19, structural racism, maternal mortality, clinical trial diversity, and peripheral artery disease, particularly with respect to amputations. And we also have had recent meetings with some of our legislated elected officials, and we are most pleased that in July we were able to sign on to the COVID-19 Bias and Anti-Racism Training Act that was sponsored by our United States Vice President-elect Kamala Harris. Unfortunately, structural racism is still a problem in medicine, and the association has been on the forefront of letting other professional organizations and communities know how these exist, and then coming out, combating this head on and reducing it to erase it so that it no longer impairs our ability to achieve healthcare or to train our students. Looking into the community, I want you to focus on the center there where it says Spirit of the Heart. This is one of our community programs, Spirit of the Heart, and that's what we're engaged in at this moment. As Dr. Ubani stated, this is our first virtual Spirit of the Heart, certainly brought on by the coronavirus pandemic. You can see some of our other programs such as Choices, Generations, Why Children Should Know Their Grandparents and Become Great Grandparents Themselves. And we've partnered with many community organizations such as those pictured on the left on initiatives such as those on the bottom over our last 46 years. It's very important that we understand how we can have a lasting impact on our communities. So with our Community Health Advocates Training Program, we're able to build capacity, engage communities, mobilize communities, and use a systems approach to training people in a very specific way and activating them to perform in their communities. We currently have 2 chat programs going on, one in Jackson, Mississippi, and one in New Orleans, Louisiana. And we have an influenza vaccine campaign ongoing at this moment. We've learned a lot from our community programs, and what we have seen certainly is that there's been a tremendous impact of high blood pressure on the African American community. Unfortunately, this has yet to be eradicated, and so we're now initiating the launch of our EDIT Control BP program, which will identify, educate, and treat people with high blood pressure. The need for this is unfortunate because we've seen that despite knowing about high blood pressure and awareness of blood pressure, we still have inadequate control, and high blood pressure continues to attribute for much cardiovascular disease. This has been particularly borne out in the coronavirus pandemic because we see what an important risk factor cardiovascular disease, including hypertension, has been for fatal illness. Unfortunately, we also see that this is beginning in younger and younger people, so it underscores the need for us to have innovative approaches to detect and prevent this over the lifespan of an individual. Looking now at our community, at our continuing medical education committee, the pandemic has certainly brought us to more virtual engagements with this as well as bringing us to a higher understanding of cardiovascular disease, because cardiovascular disease is such an important risk component for severe COVID disease. So these are just a list of the 4 webinars that we've produced. They're available on our website, and this gives a lot of information on our current thinking of coronavirus so that we can teach practitioners how they can combat against it. We're also very concerned with what has happened with structural racism, and at this very moment, we are engaged in a symposium at the American Heart Association scientific sessions on structural racism as a public health crisis. You can see here our president, Dr. Michelle Albert, is leading the symposium, and for that reason, she is not able to join us and deliver this address for you today. The recent unrest, and particularly the tragic events surrounding George Floyd, have forced us to realize that we must gather others in our professional societies and our other allies together so that we can combat the systemic racism that exists, so that we can promote health equity. We have been very active in this regard, as well as being vocal in journals and magazines, webinars on what can be done to promote health equity in medicine. We've also been very active in publishing our results in terms of what we see as very important on how we can address the toll that COVID-19 has had on our communities. And one of the diagrams that brings us to light is this one, which shows that the COVID-19 health disparities have been playing into what we see now in terms of overall health disparities, and we provide solutions for practitioners and other people engaged in healthcare policy to understand, so that we can try to overcome this inequities that we see. Certainly knowing that most people don't really read Circulation Journal or other medical journals, we've provided a lot of this information on our website. And so we now have Coronavirus Education Hub called FAQ Watch, in which we can provide medical information for healthcare practitioners, as well as information for the community, such as our COVID-19 guidelines and overcoming common myths and misconceptions regarding coronavirus, and certainly the importance of wearing masks. Now, just to touch on our membership, we are very, very pleased that our membership has grown to over 2,000. Most of our members are community health advocates, so that they're not necessarily MDs or nurses, but they're very, very committed to cardiovascular disease in African Americans. We're very pleased to report that most of our new members now, over 50%, are early career members. And we'll see in the next slide why this is so important, because the numbers of African Americans and other minorities that are entering the cardiovascular specialties is extremely low. And we don't think that this number is going to be enough to support our communities, particularly as our communities are aging. For this reason, we've established a cardiovascular workforce initiative, which tries to span the globe, span the spectrum of potential trainees for cardiovascular disease, starting from the middle school level, going through medical students, and particularly with cardiology fellows and subspecialty training, by providing interactions for professional education, as well as research promotion, and certainly most importantly, grants and scholarships for them. So with your continued support, we feel the ABC is well positioned to broaden its mission to achieve health equity for all through the elimination of cardiovascular disparities. And we have one simple ask, and that is for members to recruit at least one new fellow over the next 6 months. And we want non-members to participate in one health promotion activity. Hopefully you'll also see that you can join the organization as well. Consider that and understand that we have complimentary memberships for people who are community health advocate trainees. Certainly last but not least, we want to thank our sponsors. Our sponsors provide much needed financial support, but in addition to this, they also provide us with partnerships to understand and keep us up to date on the newer therapies. They help us to understand changes in the healthcare landscape. They give us research opportunities and access to clinical data, and support our community engagement and awareness activities. For this event, we want to give a special shout out to Amgen, AstraZeneca, and Edwards Life Sciences for their extreme participation to make this all possible. Lastly, I would want to thank you, our audience, for your participation, as well as our hosts, Dr. Rubani and Dr. Baptiste, our panelists, the wonderful staff that we have at the Association of Black Cardiologists, and the African Heritage Foundation for crafting this opportunity for us to learn together. I'll be available throughout this symposium. And so if you have any questions or comments that you would like to share with us, please put them into the Q&A section and I'll be able to address them there. Certainly, thank you for all your participation, and I'll turn it back over to you now, Dr. Rubani.
Thank you so much, Dr. Underwood, for such an important information. Now remember, if you guys are just joining us, this is our first virtual symposium. If you are interested in becoming a member of ABC, please visit the website at www.abcardio.org. Thank you again, Dr. Paul Underwood.
Well, thank you, Dr. Rubani.
So next, we have our special guest and friend of ABC, Mr. Lamman Rucker, who will tell us why heart health is important to him, and he'll also help us kick off and wrap up this interactive session. Welcome, Mr. Lamman Rucker.
Good morning. Thank you, Dr. Jackie. So on behalf of myself and my entire team, all the other incredible people who've been working in this space and committed to this work, I thank you for having me. And I also just want to respectfully acknowledge and show my appreciation to your commitment to this work. So whether you're a sponsor, community advocate, whether you specialize in this industry, whether you're someone who's a cardiology survivor of any form, I'm just really proud and very elated to continue to be part of this really, really dynamic community. So thank you for having me, and I applaud all of you for, again, for your commitment and hard work in this space. So my name is Lamman Rucker, and I'm very happy to be with you. You've got a wealth of information that's going to be available to you throughout this forum and this wellness symposium. My passion for social justice and community empowerment and health and wellness has driven me to be a spokesperson for many charitable efforts. But this particular one, the Association of Black Cardiologists, is absolutely dear to my heart, literally. So I want to thank ABC and for having me as a part, and I believe an integral part of its community education programming. As an ambassador for good health and healthy families, I've partnered with ABC over the years, providing communities with lifestyle, nutrition, fitness, healthcare information of all types that has helped us all live healthier lives. It's a fact that cardiovascular disease is the leading global cause of death. That's 1 in every 7 deaths in the US being from heart disease. So to me, what that also says is it's likely that 1 in 7 of our own family members either have been affected or will be affected by heart disease. That speaks very clearly and very loudly to me. But I also believe that there's good news, and that good news is that it is preventable. By taking control of our diet, making time to exercise and eat well, and encouraging one another, and in particular throughout our families, to care and prioritize their bodies, we can win. We will win as a community. So I would encourage you to visit the Association of Black Cardiologists website for heart health resources, and also to revisit and discover for many people what the 7 steps are to a healthy heart. And they are the following. I'll give you a second to get your pen just in case, or pull over your phone and open your notes, or start a text to someone, or return a text to somebody, and you can even maybe surprise them with this very valuable information. All right, so here we go. Number 1, be spiritually active. So we believe that heart health is not only connected to physical exercise and activity, but also spiritual exercise and activity. And I think a strong spiritual relationship also is connected to a healthy heart. Step number 2, take charge of your blood pressure. All right, you can be actively involved and actively engaged in taking charge of your blood pressure. Step number 3, control your cholesterol. Of course, cholesterol levels are also very important factors. Step number 4, track your blood sugar. So blood sugar is also a very important variable. Step number 5, as I said, eat smart and enjoy regular exercise. Can't go wrong with that one. Step number 6, I'm going to get close to the camera on this one. Don't smoke, okay? Don't smoke. And if you're smoking, please stop smoking. Do your very best to eliminate smoking from your habit as soon as possible. Your heart and your family and your clothes and your curtains and all kind of other things around your house probably will thank you. Step number 7, access to better health care and take medications as prescribed. Those are incredibly important things. So again, number 1, be spiritually active. Number 2, take charge of your blood pressure. Number 3, control your cholesterol. Track your blood sugar. Eat smart and enjoy regular exercise. Don't smoke, and access better healthcare and take medications as prescribed. Those are our 7 steps to a healthy heart. So these steps can not only preserve your heart and your temple, but also your overall quality of life, and even add years to your life, which is also very important. So we hope today's symposium will be filled with information on cardiovascular health and COVID-19 insight, nutrition, and self-care that we can all live by. And you, the audience, will be an instrumental part of this symposium, and making it a very interactive and successful program. So what we want you to do is enter your questions into the Q&A box, and then our moderators will be happy to have our speakers address them throughout the program. So thank you for your time, and we really appreciate you being with us and joining us today. We hope the information that you're going to receive will be valuable to you, your family, and your areas of expertise. And it's now my pleasure to hand things right back over into the more than capable hands of our lovely and brilliant Dr. Ubani, who will moderate our town hall panel. And that is entitled Disparities in Treatment of Cardiovascular Care in Minority Communities.
Thank you so much, Mr. Lamman Ruckers, for that important information. I hope all of you remember your 7 steps to better cardiovascular health as laid out by Dr. Lamman Ruckers. And if you learn it, you should teach family members and friends so that we can work together to decrease the deaths from cardiovascular disease. Thank you again, Mr. Lamman Ruckers, for that. So for those of you just joining us, thank you for joining us and welcome again to our first virtual community forum and wellness symposium. So next, we're going to move on to our first panel session, which I will be moderating. I'm very excited to be moderating this session. We have 4 exceptional panelists who will be discussing disparities in treatment in cardiovascular disease in the minority communities. So what I'm going to do is I'm going to ask each member of the panel to introduce themselves and to introduce also the organization in which they represent. Then I'm going to ask a series of questions to each member. Audience members or viewers, you guys will have an opportunity to ask questions as well. If you can type your questions into the Q&A section of this box, and occasionally I'll look at the questions and I will pose it to our panel. So if everyone understands, we can go ahead and get started. So I will let the panel introduce themselves. Let's start out with Ms. Letitia Clark.
Thank you, Dr. Ubani. My name is Letitia Clark. I serve as the Mayor Pro Tem for the City of Tustin, and that is located here in Orange County, California. Tustin is somewhat of a medium-sized city. We have about 83,000 residents, and we're actually comprised of about 40% Latinx population. So although some may not consider us to be much of a minority city, we do have a good deal of people that would be considered minorities here in Tustin. We have a military history. We used to have a Air Marine base here in Tustin. And so we've had a lot of people from all around the world come through Tustin and have found a home here. So many families from various places throughout the nation have planted some roots here in Tustin and continue to live here with their families. Thanks for having me.
Thank you, Mayor. So next we have Reverend Kenneth Curry.
Yes, again, my name is Reverend Kenneth Curry. I pastor the Friendship Baptist Church, Yorba Linda, California. I've just celebrated 7 years of pastoring there and have actually served this church now for 19 years. Friendship Baptist Church is a predominantly African-American church in North Orange County, Yorba Linda. We've been we started out in Fullerton, but we've been in Yorba Linda now 35 years. Our church is 56 years old, and we serve an African-American community that's extremely diverse in that we serve those that come from Orange County, but also coming from Los Angeles County, Riverside County, and San Bernardino County. And so being the first in North Orange County back in 1964 in the middle of the Civil Rights Movement, Friendship was and continues to be a place where African-American community can gather, share information, and create community, especially since we don't have our own communities as much anymore. And so very proud to pastor that church, very proud that Letitia Clark is a member of our church as well, and glad to be a part of this symposium and panel again this year. Thank you for having me.
Thank you so much, Reverend Kenneth Curry. Next, we have Mr. Robert McDonald.
Good morning. Thank you. My name is Bobby McDonald, and I'm the President and Executive Director of the Orange County Black Chamber of Commerce here in Orange County. I'm also a member of the Orange County Veterans Military Families Collaborative. And I'm also came up with a new group. I'm co-chair of the Orange County Diverse Business Leadership Coalition. One of the things that we have been talking about throughout our different areas is we call it HEHE: housing, employment, health, education, and legal. And this is why this panel and the symposium is pretty impressive and wonderful to be on. I come from a long line of Buffalo soldiers. My dad and my 5 uncles were all Buffalo soldiers. And the military piece that I'm looking forward to being on this panel about is to talk about some of our veterans and some other people in the community, our people in our community that really don't get the information about this important discussion we're having now. So I'm glad to be here and thank you and look forward to being part of the panel.
Thank you for that, Mr. Robert McDonald. Welcome. Next, we have Mr. Larry Wood.
Hi. Well, thank you very much for being here, or for allowing me to be here today and talk to everyone. My name is Larry Wood. I'm the Corporate Vice President of Transcatheter Heart Valves for Edwards Life Sciences. I've been about 35 years, and one of the things we do is a lot of cardiovascular research. And one of the things that we've struggled with is minority enrollment in a lot of our clinical trials. And even once the device is approved, getting those innovative technologies out into the community has proven to be a challenge. And so this is just an area I'm passionate about and trying to improve access to, especially innovative technology in communities right now that don't have good access, and there's a lot of disparity. So I'm grateful to be here and be part of this panel.
Awesome, great. Welcome everyone. So we'll start with our questions. Viewers, don't forget to type in your questions in Q&A, and I'll take a look at it every once in a while and pose the questions to our panel group. So our first question, we'll start off with Letitia Clark. I'll just ask one person and we'll have anybody else chime in if you have anything else to say. So the first question we have is, what are the biggest challenges or problems we face when addressing cardiovascular health addressing cardiovascular healthcare disparities in minority communities, especially during the pandemic?
Well, great question. The pandemic, I don't think it necessarily increased the number of issues that we have in addressing heart health and other disparities in health in the minority community, but it definitely shone a light on just those exact disparities. And if anything, it just shows that we have some issues with access. When we're talking about access to affordable healthcare, to healthcare, regular healthcare, just even things like pharmacies and recreational activities. The actor Lamman talked about just being able to get out and take care of your physical health. We know that gyms shut down during the pandemic, but even access to just green space is sometimes an issue in minority communities. And as a council member, this became an immediate issue when we had to shut down parks around March or April, because we didn't want people congregating in fear that they could transmit the virus very quickly. So we shut down access to all parks. But what we realized was that we said you could do some passive walking or running, but we didn't want people physically driving to parks. But what that did was it immediately isolated many parts of our minority communities who didn't have access to parks in terms of walking to parks and green space. And so to me, that really showed us that we have some work to do in terms of access of quality of life amenities and services throughout the community. And we see that there are some disparities in parts of the community where there are families who are underserved and marginalized. And we also need more what we call federally qualified health clinics, so FQHCs, throughout the community. We only have one right now in our community, and that allows for anyone, no matter your income, no matter your health coverage, to be able to get the services that you need. One of our FQHCs in town provides food, diapers, all kinds of amenities that a normal health clinic wouldn't provide, and that you would also need health coverage in order to gain some of those services. So I always tell people, I know we're after the election, but the census is very important, knowing, being counted in our census, that allows us access to federal and state funding, and then also making sure that you elect folks that are mindful about these resources and how to tap into them and how to allocate them so that there is access provided to everyone throughout the community. That's why it's so important to participate and stay engaged. So, as far as I'm concerned, I'm going to be advocating for more federal and state dollars to increase our accessibility in the community, and really advocating for another FQHC, which can be also supported by community development block grants, CDBG funds that we'll be able to access. But we see that sometimes these health disparities are also increased because other basic needs aren't addressed, like food and shelter.
Right.
And so it's really important that we as a community, from my position as an elected official, being able to support rent or mortgage assistance, being able to support food or transportation, now even Wi-Fi, just being able to get to school or being able to work from home has become a disparity. If people can't do that remotely, we find that their income or their ability to take care of their family is even jeopardized as well. So supporting some of those basic needs allows you to have the luxury to take care of your health as well. But I think the key part is access. And I know I probably ran a little over my time, but from my perspective, that's really what's important.
Thank you for that, Letitia. Definitely access to funding is very important in addressing cardiovascular healthcare disparities in our communities. Does anybody else on the panel have anything else to add?
I just wanted to add with, along with access, is the idea of trust and building trust within the African-American community for healthcare system, for doctors, et cetera. I know we've added, to this question specifically during the pandemic. I think that it is important that we articulate that leaders in the African-American community articulate that we can trust healthcare providers, trust healthcare workers, et cetera, and that we have a partnership, myself as a pastor, with healthcare providers, with doctors, and create opportunities for information, because I know that while we have these disparities, a lot of it is that some of our members of our community don't trust the healthcare system for one reason or another. We know that there's some historical beliefs. There are these ideas that, if I articulate it, then I could, easily die. Even early on with testing for COVID, a lot of individuals did not want to go out to be tested. And so I know that that's important as a pastor, as a leader. For me, I try to stay engaged and keep the information, stay up on the information so that I can communicate it to my congregation. So not only what they hear on the news, but what I'm able to gain and learn through partnerships like this. And then I know my people trust me. So if pastor said it, right, then they'll believe it all the more. I think there's got to be ongoing relationships with community leaders, of course, civic and our elected officials, but with pastors, especially in our African-American community, they have a great opportunity to speak directly to their congregation. So I think trust and familiarity are also some of the things that we need to utilize to navigate through this.
Thank you.
Dr. Ubani or Jackie?
Yeah. Yes.
I just wanted to briefly add, I think that the pastor Reverend just hit on a nice piece. One of the mottos of the Black Chamber for all these years, for the 37 years we've been here, has been access to information. Yeah. And I think that's the big disparity I find in our community, in our communities. We don't share this kind of information, and this is not one of the top fun things or sexy things to talk about. Right. But we have to do this. We have to keep driving it, because as I mentioned before, a lot of these things come from the past, and people just pass it on to their families. And if that's integrated into your household, you take those and you don't listen. So I think the discrepancies is, access to information, making sure individuals get it, but get it in a positive way, and keep putting it out. The things we do with the chamber is to make sure that we have that access to information and put more information out during our newsletters and on our website and stuff we do. It's got to be something we just keep driving home. A healthy business is a good business.
I agree with both of you. I think you guys have hit the nail on the coffin. Trust is definitely a big issue.
On the coffin.
Trust, nobody will follow advice of the experts. But let's move to our next question. Let me look at the Q&A box. We don't have any questions from the audience at this time, so we'll move on to the next question. Actually, we have a question here from Shelly Henderson. I think this is an awesome question, and it kind of flows easily with what we've been discussing. This question is for Mr. Larry Wood, and it says, there are historical reasons that African Americans are skeptical about enrolling in clinical trials. What are you doing in your position to address or alleviate this?
Yeah, no, it's a great question. And I think one of the big issues has already been brought up here a couple of times, which is trust. It's trust in the system. And there's some very valid historical reasons why people of color are distrustful of the healthcare system. But we have to change that, because people rejecting care or rejecting even diagnosis is a terrible thing. And I will tell you, even at our company, where we have, we're able to offer our employees good health insurance, we had to start a program a couple of years ago called Know Your Numbers, which actually required every employee in the company to get a health screening, which meant their blood pressure checked, meant getting their pulse checked, a stethoscope put on their chest, and basic blood work done. And when we did that, we found all sorts of employee issues that were a problem. And so I feel like there is an opportunity to engage trusted places such as the church. I think Pastor Curry's comments are super strong when he stands up in front of his congregation and says, you can trust these people. I'm bringing these healthcare workers to our hospital and they're going to do basic health screening and you can trust them. When he says that, it's about the most powerful thing that he can do. He can change so many lives when he encourages people to do those sorts of just basic diagnostics. And what's really sad is so many of the diseases we're talking about, like hypertension, the drugs that treat hypertension, first line defense, are all generics. They're not expensive drugs anymore. It's not expensive therapy, and it can totally change people's lives. To answer the question directly about clinical trials, that's even a greater challenge. We actually, in our transcatheter heart valve trials, we had a difficult time getting minority enrollment. So we actually took and ran a trial arm where we went to communities that would otherwise not have qualified to have a transcatheter heart valve center. And we started a trial there so that we could offer the therapy to patients and try to drive minority patients into it. And I will tell you, even with all of that work, even with making it economically feasible, even with working with the local clinicians in those areas, by the time we got the trial up and going, and we finally started getting enrollment, the whole trial had completely enrolled and it was closed. So it just really highlights the amount of work that we have to do in this area. But I would honestly say the biggest bang for our buck that we can get is improving the diagnosis of things like hypertension, diabetes, and those things, and getting people those basic treatments. And if we can get the trust started there, then I think we can start a positive momentum to getting people to trust the rest of the healthcare system.
Great, that's awesome. Yeah, excellent point. So, okay, so moving on. So we're going to go on to our next question. Most of these questions really tie into each other, but we'll do just a quick summary. The last question of the panel, since we're almost out of time, we'll say is I'll leave it open to any of you to answer this question. And the question is, what advice do you have for us to improve awareness and access to care? I know we've touched on some of this, but let's go ahead and maybe summarize the whole thing for the audience members.
I'll jump in first. I think that if we can work with communication, I know that we believe we live in a technology driven time or dispensation where there's information everywhere, but the real issue is that people don't know what information they can trust, right? And so I think that we have to work on how we communicate to the African-American community, specifically as we talk about that today, what means of communication we use, and then our how regular that communication is. I know that, October, we talk about breast cancer awareness. November, we talk about men's health and cancer. So No Shame November. I think that thinking through a planned blitz of communication that happens, and maybe we tag it with some of these other things, but that we get this information out to the best of our ability and use all of the mediums. I mean, I think your panel shows the diversity. Me from the religious sector, Letitia Clark from our political and policy, Bobby McDonald coming from that community activism piece. I think as you bring all of those together, there's an opportunity for us to really make headway. And we're going to need that, right? Not only as we talk about heart health, and this became more important to me when my father had a heart attack, and now I have to go in, right? And when I get a physical, I need to say that I have heart disease in my family. But being able to articulate that and get that information out as we blitz together will make a huge impact, in my opinion, on what we're able to do.
Hey, Jackie, I'd like to bring up a couple
things
that I thought was important, because, so what advice do you have? I kind of picked up some advice today as I'm listening to the panel, what we could do through the chamber to take care of that access to information. I loved what Mr. Wood said a few minutes ago, Larry Wood just said about he needs to get more people involved in the outreach to come in and volunteer. And with me being on that diverse business council, coalition, with the Hispanic Chamber, the Asian Business Association, and those groups, we could use that information, Larry, if I can get it from you, and put it out, because we have access to that. We've got access to having a group of people that will pay attention, because we'll put that out. The second thing, from a veteran standpoint, I managed to reach out to the Long Beach VA, speak to the PR gentleman, and we now have set up, we just had one last week, and we're getting ready to have one on the 5th of December, where we're going to have the VA come out to the community, to 2 VA centers, American Legion Post and VFW Post, and do a pop-up clinic where they'll be able to get a flu shot and COVID testing. The whole fun part about doing that is they drive in and do that will give us an opportunity to get more awareness out. And so when the COVID vaccine comes out, people won't be as scared of the disinformation. They'll know that the Veterans Administration is involved and the community is involved. And that's another way we're trying to do something, especially with the flu season and that pumps on. So those are 2 things that I wanted to interject to the group today. Okay.
Dr. Ubani, I would agree with my pastor, Pastor Curry, and Bobby as well. And in addition to serving on the council, I have a daytime job. I work as a public affairs director for a community college district. So I'm in that PR world a little bit. And they say in marketing, someone needs to see something 7 times before they even remember it. And so if you think about that, as well as infusing faces like yours, the community knowing that there are African-American doctors who focus on this area of health, and really knowing that there are people that they can trust and that they see themselves in people like you is really important to infuse in the marketing. Also in public affairs, we say content is king and video is huge. So any ways that you all can create more content via videoing. I see a lot of doctors doing TikTok now. I think you have to embrace some of those ways of engaging the community. And if we're talking about creating a new generation of people who think differently about how to engage our medical professionals and how to take care of their health, we do have to reach younger people. So when it's time for them to start addressing how they take care of their health, they are cognizant of that. And I think reaching them via social media is really important as well.
Awesome, thank you. So now we're going to go over just to the chat box really quickly and just review some of the questions or comments that people have. Here's a comment from Ms. Shelley Henderson. She says, I think corporations, organizations who want African Americans to engage with clinical trials, etc., they must consider partnerships with churches and community organizations that are trusted in the community. The funding available should reflect this. I think we've all touched on this, and I think I agree with this. Anybody else have any comment about that?
I would just say I agree. I feel like we talk a lot about undertreatment, but I think underdiagnosis in these communities is a much more serious issue. And fortunately, it's a much easier solved issue because the diagnostic tests are fairly simple and fairly inexpensive. If we can improve diagnosis rates and we build that trusted first link in the partnership that the Reverend Curry talked about, then we can get that next link in the chain going, which is the treatment and the trust in the healthcare system. But we've got to improve the diagnosis, because I know hypertension and diabetes are terribly diagnosed nationally, but in communities of color, it's far, far worse. And I feel like we have to address that issue first. Regarding clinical trials, I think we learned a lot. I think the comments that have been made here, I think, are right on. We do need to continue to work with trusted sources, advocacy groups that when people get the information from it, they inherently trust it rather than it being inherently skeptical. And I think as companies, we just have to do a better job at that and find better avenues to do that. We tend to focus on the hospitals more than the communities. We tend to focus on the doctors more than these other avenues. And I think we just have to get better at it. And that's one of the learnings we had from our trial.
Agreed. We have another comment here from Dr. Batiste. He says, knowing your number is the same as knowing your bank account balance or credit card limit. You cannot afford to get overdrawn. Thank you, Dr. Batiste, for that comment. I agree with that 100%.
And I agree as well. I think it goes back to that whole idea of what Mr. Wood just talked about in terms of diagnosis, getting our people into the doctor to have a yearly physical. I've had members that because we've done health fairs at our church have found out things about their health and we're able to make great improvements and address it early. I've had members, because we've focused on health, actually, discover not only maybe heart disease, but other diseases, cancer, et cetera, because they looked into the information early. And I think we have to talk about the importance of a yearly checkup. We have to talk about family history, those types of things, so that individuals understand the importance of going into the doctor. There are many in our communities, like we've said before, that are afraid of going to the doctor, and they need to know that there's nothing to be afraid of, and how important it is to go every year. And I'm thinking now, I love what Letitia Clark said in regards to even a younger demographic, because some of our young people don't feel that they need to go in and get a health screening and checkup, and they really do. And I know that even some of the healthcare stuff banks on the fact that younger people won't get sick, they won't go to the doctor. And so it's supposed to be this balance, right, in terms of who we care for. But we have to also get to the younger people that it's important for them to not take risk with their own health.
Jackie, I think that the title of this webinar, Spirit of the Heart, is apropos and right on point. You look at the panelists, we all know each other pretty much, but we all been working together. Now we have us really putting together. We can put this on the Black Chamber website. We can send it out. And if there's a plus to COVID, we're a lot more knowledgeable about the different things that have come out. I mean, it's at the surface, all the other stuff that comes along, but it's at the surface. Because when you're having conversations now with someone about health, and they mention, and especially a veteran, and if they've been to Vietnam and they got Agent Orange, and all of a sudden they're talking about, I think I had diabetes. Well, Agent Orange helps you get diabetes. Or sarcoidosis. We hear about this, some of these other diseases we have, like sickle cell, but sarcoidosis is part of the nature of African Americans and other indigenous people. Be that as it may, the spirit of the heart is apropos. We're going to see a bigger influence now of people understanding what they have and what they don't have and what they need to get it over with. Thank you.
Absolutely. Well said. Very well said. There's a comment in the chat box from Williams. He says, barbershops and beauty salons are additional trusted resources for disseminating this important information. So that's also a great source.
They're closed now.
Yeah, absolutely. So there's I think we have time for just one more question I see here in the chat box that we haven't addressed. This one is specifically for Mr. Larry Wood. And it goes like this. Can you discuss why we should believe in technology from Edwards Life Sciences, and what distinguishes your products from other companies?
Yeah, well, in terms of clinical research, unfortunately, a lot of the historical things that have happened, which there's a lot of things that happened that were pretty poorly done. But I would say the oversight of FDA now on clinical trials for all subjects, and the oversight that happens now is so robust that I think any patient entering into a clinical trial is very, very well protected. There's data safety monitoring boards, there's clinical events committees, and I think subjects are really well protected. I can say I would let any of my family members enter an FDA clinical trial, or friends or anyone, because I believe the protections are fundamentally built in now, and we have better informed consent and a lot of other things. So I feel like the healthcare system works pretty well now. It's just we have to get over this historical trust issue and get people confident in again. And unfortunately, I think all of us who work in the medical field have a responsibility to try to improve that. And most of us weren't around when some of these things happened, but it doesn't make it any less real.
Yeah, and I think we also have to make going to the doctor, getting these screenings, et cetera, the norm. They cannot be an anomaly. They can't be because I feel something, I've got a pain here, et cetera. We've got to make these things the norm, where people will see that it's part of what they do every year. Just like I get my car registered every year, every 4 or 5 years, I get my driver's license update. whatever the case may be, that this is regular and a part of our community. And it hasn't always been. We haven't always, not just out of fear, that this is, hey, this is what we do. We take care of ourselves. A lot of time we talk about healthcare from a fear perspective, and I'm sorry, Dr. Jackie, I know we're going on, but
No, go ahead.
Fear perspective, but this is a part of what we do, and other communities do it. We just need to be encouraged. Hey, this is what we do. We take care of ourselves. We don't wait to, find out that our sugar is bad. We're having our doctors run tests. And, I have my physician, he says, Kenneth, your health is your health. So if I want something, I ask. And if he says why I can't get it, he understands my insurance, et cetera. But I at least ask. When Chadwick Boseman passed away, I know that there was a run-up, especially for African-American men, to look at cancer. All of these things, I think that we have to start to make the norm and not an exception.
People take better care of their cars than they do their own health. Nobody would wait until their car didn't stop to go get their brakes looked at, but people wait till their body hurts before they go to the doctor. We've just got to change that mentality.
I think the pandemic has breeded creativity through crisis, right? We've seen how you can get a checkup in your car. We see that you can go to unexpected places like the Honda Center or Dodger Stadium to get a test. We as a community, as a society, may need to change as well. If we can't bring the people to a clinical site, we may have to go to them. And so we may see an increase in mobile clinics and making sure that you can get some of these diagnoses and tests in unlikely places, maybe like barbershops, or, we have to get creative because it's too important. And we can't just continue to do the same thing. As Pastor Curry was saying, we have to create this to be more of a part of your norm. And so that may force us to be more creative in how we offer services.
Awesome. Any last minute comments before we wrap up?
I have one more, Ms. Jackie. Just one. Thanks to the program. I'm going to show the spirit. I'm going to have a landing page here next week. I'm going to start and have a wellness page or healthy heart page on the Black Chamber website. I'm going to put this up and some others. So if anybody wants to give me some information to put up there and I can help, I'll be glad to. So I'm going to start that as of next week. All right. That's blackchamber.com. All right.
Excellent.
Well, rich discussion. This has been phenomenal. So thank you to Mayor Pro Tem Clark, Reverend Curry, Bobby McDonald, Larry Wood. Tremendously valuable resource that we provided to those tuning in. And Dr. Ubani, you have been incredible in terms of leading out in this discussion. And so it's my pleasure. My name is Columbus Batiste, and I'm one of the local interventional cardiologists. And Dr. Ubani introduced me a bit earlier, but I have the privilege and honor of introducing Dr. Jacqueline Ubani as she prepares to present to us this morning. And one of the things that we've known about her is that she's a board certified cardiologist and electrophysiologist. And for those of you out there who don't know what that is, that's an electrician of the heart. I'm a plumber of the heart. She's an electrician of the heart, but she's also an author and best-selling author for Women in Heart Disease, The Real Story. She attended the University of California for undergrad, Boston University for medical school, and then joined the US Navy after medical school and completed her internal medicine residency at the Naval Medical Center in San Diego, where she did her cardiovascular fellowship, subsequently at the Naval Medical Center in Bethesda, with subsequent electrophysiology fellowship at George Washington University in DC. So Dr. Ubani is extremely an excellent clinician. She's active in the community. She serves as an active member in the American College of Cardiology, the Heart Rhythm Society, which is the main governing body for electrophysiologists. And she currently serves as president of the Orange County American Heart Association, participating in advisory boards related to heart disease across the nation. And she's been invited as a guest speaker on television, radio shows as it pertains to heart disease, lecturing on the international stage. So we are honored to have this excellent clinician with us. She's received the Physician of Excellence Award in 2017 and 2019, both from the Orange County Medical Association. So it's with great honor that I introduce her and invite you to listen and prepare your questions inside the question and answer queue as we listen to Dr. Ubani.
Thank you so much for that, Dr. Bautista. Thank you again for allowing me to give this lecture. It's always my passion to educate about heart disease, especially in our community, because we see that we are the biggest victims of this highly preventable illness. So let me see if I can move my slides. Okay, so I'm just going to be discussing heart disease and just really trying to educate people about this disease and how you can really prevent the disease. So we know that the health of African Americans in this country has just not been very good. Currently, African Americans have the highest rates of hypertension, diabetes, and coronary artery disease, which has led to high levels of premature deaths among African Americans. As a result, the life expectancy in African Americans is lower by about 3.5% compared to most other ethnic groups. It remains 38% of mortality difference is seen higher in African Americans compared to any other ethnic groups. So again, heart disease is the #1 killer of people in the United States. Like I mentioned earlier, we see higher rates in African Americans compared to any other ethnic groups in the United States. African Americans are 30% more likely to die from this disease. And what we're seeing actually now is that we're seeing heart disease in younger and younger African Americans. But I know all this is grim news, but the good news is that you can decrease your risk of heart disease by up to 80% by just implementing some simple lifestyle changes. So when we talk about heart disease, we talk about your risk factors for heart disease. When we talk about the risk factors, we group them into two separate groups. We say the modifiable group, which is things that you can actually modify or change in your life to improve your cardiovascular health. And the non-modifiable group, which are things that you're born with and there's absolutely nothing you can do about it. Some examples of non-modifiable risk factors include age. We all know that as the older you get, the higher your risk for developing heart disease. Ethnicity, African Americans tend to have higher incidences of cardiovascular disease. Family history of premature coronary artery disease, which is defined as women in your family having heart disease at 65 years and younger, and men having heart disease in your family age 55 and younger. And the modifiable risk factors are things that you can change, and they include things like obesity, physical inactivity, smoking, excessive alcohol consumption, hypertension, diabetes, and hyperlipidemia. And I'm going to go into detail with all these modifiable risk factors. So we know that in terms of obesity, African-American women have the highest rate of obesity compared to any other group in the United States. They're 1.3 times more likely to be obese. And of course, we know that with obesity comes medical issues like hypertension, high cholesterol, and diabetes, which, like I mentioned earlier, are all risk factors for coronary artery disease. So what is obesity? In the medical literature, we use this measurement called the body mass index to figure out if a person is obese or not. So it's an equation that takes your weight in kilograms and divides it by your height in meters squared to come up with a number. You can actually download this formula onto your iPad, iPhone, or whatever tablet you have and figure out what your BMI is. Underweight is when your BMI is less than 18.5. Normal weight is between 18.5 and 24.9. Overweight is between 25 and 29.9. And obesity is defined as a BMI greater than 30. And we know that the higher your BMI, the higher your risk for developing heart disease. A simpler way of determining your risk for coronary artery disease is by measuring your abdominal circumference. For some reason, fat accumulation in the abdomen is more detrimental to your heart than fat accumulation anywhere else in your body. So the literature recommends, measuring your abdominal circumference. And you do that by just taking a tape measure, putting it around your waist. You want to put it around your waist at the level of your navel or your belly button, not at the level of your belt. Okay, so you measure your abdominal circumference, and if your abdominal circumference is greater than 35 inches and you're a woman, or greater than 40 inches and you're a man, your risk for coronary artery disease or cardiovascular disease is high, and you really should try to implement some lifestyle changes to improve that risk. So of course, heart healthy eating. I don't like to say diet, because when you say diet, people just get turned off and don't want to pay attention to it. There are 3 diets in the literature that have been shown to improve your cardiovascular health. And they include the Mediterranean diet, the DASH diet, and the therapeutic lifestyle changes. I'm not going to go into heart healthy eating in detail, because I know that the next talk from Dr. Batista is going to really focus on healthy eating. So we'll save that for him. But the overall point about this is you don't have to lose excessive amounts of weight to benefit from a cardiovascular standpoint. Literature shows that if you lose as little as 10 pounds, you can actually decrease your blood pressure significantly and decrease your risk for developing coronary artery disease. So you start slow and take it one day at a time and one step at a time. So physical activity is very important to your cardiovascular health. The ACC and the American Heart Association recommend a minimum of 150 minutes of moderate physical activity a week, or 75 minutes of vigorous physical activity a week. 150 minutes is just 2.5 hours. That's the amount of time that it takes you to watch your favorite movie. So people ask, what's moderate physical activity? We say moderate physical activity is something that you can do while you're talking, whereas vigorous physical activities is activity that you do and you can't talk because you're just really exhausted. So examples of moderate physical activity include brisk walking, dancing, gardening, doing some household domestic chores. An example of vigorous physical activity include things like running, walking, fast cycling. So things that really make your heart rate go up really high. So we generally recommend, if 150 minutes is too much for you, just start slow. Start slow and increase as tolerated till you get to this level. And once you get to this level and you've built up your physical stamina, you can actually increase it more as tolerated. And I recommend that if you've never exercised in your life and you do have risk factors for coronary artery disease, you really need to sit down with your doctor and determine whether or not you're okay to start an exercise regimen. And then you start after discussing it with your physician. Cigarette smoking. Cigarette smoking is bad, bad, bad. According to our literature, cigarette smoking is a leading preventable cause of death in the United States. So about 443,000 deaths in the US is attributed to cigarette smoking alone. And about 28% of this comes from heart disease, 21% come from COPD and emphysema, and 29% is from lung cancer. We know that cigarette has about 600 ingredients that gets converted to 7,000 chemicals when you light it. And 69 of these chemicals can cause cancer and extremely poisonous. So if you smoke, you need to quit smoking. If you're having difficulty quitting smoking, you should sit down and discuss with your doctor about options for tobacco cessation, whether that includes medication or joining some kind of social group to help you quit. But literature does show that the people who are most successful at quitting smoking are those that just decide they're going to do it and they just quit cold turkey. Alcohol consumption. I know most of you are familiar with some of the studies that show that alcohol is beneficial for the heart. But the studies looked at red wine, and we know that red wine is beneficial because the grapes used to make red wine have antioxidants that are good for the heart. And we say it's moderate consumption that is good for the heart because it can increase your good cholesterol, your HDL. But if you consume alcohol in excess, it is definitely detrimental to your heart and detrimental to every single organ system in your body. So what is moderate alcohol consumption? For women, that's If red wine is your drink of choice, it's a 5-ounce glass of red wine a day. If beer is your drink of choice, it's one 12-ounce bottle of malt liquor, 8 to 9 ounces of malt liquor. If you do shots, then it's a 1.5 ounce shot of spirit. And for men, men can double this. But anything more than that is definitely detrimental to your heart and most of your other organ systems. So hypertension. Hypertension is a great risk factor for heart disease. It is called the silent killer, again, because most people have absolutely no symptoms from hypertension until they have something catastrophic, like having a stroke or having a heart attack. I know that in the media, we've heard of a couple of stars, having acute strokes and passing away in the ICU. And that's, again, because of hypertension and having long-term uncontrolled hypertension and not feeling any symptoms from that. So it's very important to know your numbers. You know that 60% of African Americans are more likely to have high blood pressure that are difficult to control compared to other ethnic groups. So again, it's very, very important to know your numbers for hypertension. So in 2017, the American Heart Association came up with guidelines for hypertension. What they did was decrease the number that's considered normal blood pressure. And as a result of this, we now have a whole lot more people who have this diagnosis of hypertension than before. So normal blood pressure is anything less than 120 over less than 80. Your blood pressure is considered elevated if it's between 120 to 129 systolic, which is the top number, over less than 80, which is the bottom number. Stage 1 hypertension now is defined as systolic blood pressure, the top number 130 to 139 over 80 to 89. And stage 2 is 140 or higher, over 90 or higher. And you're determined as having a hypertensive crisis if your blood pressure is 180 over 120. You need to go to the emergency room ASAP. So it's important to know your numbers, like I said. People with hypertension tend to be asymptomatic. So you're never going to know if you have hypertension if you don't check. So very important that you do monitor your blood pressure. Hypertension is really bad because it affects every organ system in the body. It can affect your eyes and cause you to go blind. It can affect the vessels of your heart and cause heart attack and heart failure. It can affect your kidneys, cause kidney failure and requiring you to go on dialysis. For most of you, if you don't know what dialysis is, it's not a very good situation. When your kidneys fail, you have to go to a dialysis center 3 days a week, and you're attached to a machine to 3 to 4 hours out of the days. As you can see, this can really affect your quality of life. So this is not something that you want. And of course, it can cause a stroke, and the stroke can be pretty devastating. And people say, "Oh, I can get a stroke and I'll die, and that's good. I enjoyed my life." But no, you can actually have a stroke and be very debilitated, where you need a tube in your throat for breathing. You need a feeding tube, and you're in a nursing home with the poorest quality of life ever. So please take this seriously. So once you've been diagnosed with hypertension by your doctor is going to want to try a series of lifestyle changes to see if they can improve your blood pressure without having to start you on medications. So they may recommend you increasing your physical activity, recommend you eating a heart-healthy diet, recommend you that you get adequate sleep. Believe it or not, adequate sleep is very important to maintaining normal blood pressure. And also stress. Stress is a big factor when it comes to high blood pressure. You have to learn ways of reducing the stress in your life. Next slide, please. So once you've been diagnosed with hypertension and you've tried some lifestyle changes and your blood pressure still doesn't improve, your doctor will then recommend that you start taking medications for your blood pressure. Make sure you take your medications as directed. Again, like I said, people with hypertension have no symptoms, and sometimes the medications may make you feel worse than not taking the medications, but you just have to understand the risk and benefit. If you don't take the medication, you can end up with a stroke, which is detrimental, but you can take the medicine and you might feel a little different, a little weird, but you really must stick to taking your medication. You must monitor your blood pressure at home, maintain a log, and give it to your doctor. This is really the way that they use to determine which medications to put you on based on an average of all of your blood pressure numbers, instead of just basing treatment on one blood pressure measurement that you get when you come in to see the doctor. And you should make sure you go to all of your doctor's appointments. I know I feel good, I don't need to take the medicine, I don't need to take the doctor. Please make sure you take your medicine, and please make sure you follow up with your doctor as directed. Next slide, please. So diabetes. Diabetes is also another major risk factor for heart disease. So African Americans 60 times more likely to be diagnosed with diabetes compared to their Caucasian counterparts. And they're also more likely to have all of the complications associated with diabetes, to include renal failure and needing to go on dialysis, limb amputation, and they're 2 times more likely to die from diabetes than any other ethnic group. Next slide. Again, the complications of diabetes, similar to hypertension, but I think a little bit worse. Again, diabetes can cause stroke. Diabetes can cause heart disease or heart attack. If you have diabetes, your risk of having a heart attack is about the same as somebody who's had a heart attack before. Once you've had a heart attack, your risk for heart attack goes up higher. If you have diabetes, your risk is about the same as someone who's had a heart attack. So diabetes is so detrimental to the heart that it's considered actually a cardiovascular risk equivalent. So you always should pay attention to your diabetes and take care of it, because it really, really affects the heart. It can cause a neuropathy, which is where it destroys the nerves and the blood vessels of your legs, and resulting in you not being able to feel your feet and your legs, or feeling pain. The problem with not being able to feel your feet is that if you cut your leg or you cut your feet, you'll never feel it, and it'll never heal, and it can turn gangrenous, and doctors might have to amputate your leg. So if you're diabetic, you make sure you're checking your feet at all times and treating whatever wounds or injury you have to your feet. It can cause a diabetic nephropathy and causing you to require renal dialysis. Again, like I said, if you're on dialysis, have to go to a clinic 3 days a week, and you're attached to a machine 3 to 4 hours a day, and that can put a damper on your quality of life. And lastly, it can cause a diabetic retinopathy or blindness. So take diabetes very seriously. Next slide, please. Okay, so once you get diagnosed with diabetes, depending on your blood sugar level, your doctor might require you to start some lifestyle changes in order to see if you can control your blood sugars just with lifestyle changes, as opposed to starting medications. So all the things we talked about, exercising, eating a heart healthy diet, I definitely recommend consulting with a dietitian. The dietitian will help you know and understand what foods you can and cannot eat that helps with your glycemic control. You want to also make sure you're monitoring your blood sugars 2 to 3 times a day, or as directed by your doctor. And of course, if the lifestyle changes do not work, then your doctor will want to either start you on medications, but if your sugars are really, really high, they may opt to start you on insulin, which is injection kind of medication. So next we talk about high cholesterol. Cholesterol, again, also a risk factor for heart disease. We know that about 44.8% of African-American men and 42% of African-American women have borderline or high cholesterol. What's interesting is that Caucasians tend to have higher total cholesterol compared to African-Americans, but African-Americans tend to have higher levels of LDL, which is considered bad cholesterol compared to Caucasians. So what is HDL and LDL? Next slide, please. So cholesterol is the big culprit for heart attack, because cholesterol is what plaques that lay down in the arteries of the heart and prevent the heart from getting, you can go back on, you prevent the heart from getting the oxygen and the nutrients that it needs to function normally. So LDL is considered the bad cholesterol because it is the cholesterol that lays down in the arteries of the heart and blocks the artery, blocks the blood flow to the heart. Whereas the HDL cholesterol is considered the good cholesterol because it cleans up the artery. So overall, you want lower numbers of LDL and higher numbers of HDL. There isn't a blanket LDL and HDL that everybody aspires to get to. The ideal numbers really depend on your risk factors. For instance, if you have a lot of risk factors for heart disease, including diabetes, you've had a heart attack before, we want your LDL really, really, really low, like less than 70. But if you don't have all of that, we tolerate slightly higher levels of LDL. So again, it's important for you to sit down with your doctor, determine what your risk factors are, determine what your goal LDL is, and then try to work to achieve that. Next slide, please. So again, if your cholesterol is high, your doctor will recommend doing some lifestyle. You guys are catching the theme of all this. Simple lifestyle changes like exercising, eating a heart-healthy diet, maintaining a healthy weight, stop smoking if you do smoke. Don't drink alcohol if you don't drink, don't start drinking for heart health. But if you do drink, cut it back to moderate amounts. So all these are the same themes about maintaining a healthy heart. So again, physical activity, controlling your lifestyle and controlling your diabetes and cholesterol levels. Next slide, please. So briefly, what's a heart attack? I think we talked about this earlier. So a heart attack is just when you have plaques forming in the arteries that supply the heart with the oxygen and nutrients it needs. And when the heart doesn't get the oxygen and nutrients it needs, that tissue then dies, and that's what a heart attack is. And it can cause symptoms that we're all familiar with the chest pain, radiating down the arm, up the jaw, and shortness of breath. So what should you do when you have a heart attack? You want to make sure you call 911 ASAP. We say any delay in getting help is why we see poor outcomes, especially in our community. Every second counts. You want to take an aspirin if you have one, and you need to let the EMS, when they get there, know exactly what time your heart attack started. So in conclusion, heart disease remains the #1 killer of people here in the United States. African Americans have the highest rates of death from cardiovascular disease compared to all other ethnic groups. The risk of developing heart disease can be decreased by up to 80% by implementing some simple lifestyle changes, and you have the power to improve your heart health. Thank you very much, and I'm open to any questions that anybody has.
Wonderful, wonderful, wonderful. So great questions. There is a question that we have from one of our panelists. It says, do we know if marijuana smoke has the same impact as cigarette smoke on hypertension?
You know, the problem with marijuana and heart disease is there are just not a lot of studies done. So we don't know what the answer to that is. I know people want to say, oh, well, you relax with marijuana, but we don't know what the effects of marijuana truly is on the heart, especially if you have coronary artery disease or have risk factors. So the recommendation from our society is that if you've had a heart attack before, you have serious heart condition, you probably should not be using marijuana.
That's great. It was a great question because we're seeing an increased use in terms of marijuana, and questions are commonly arising about its impact. There's another question that we have that's there, and it says, what does an aspirin do for a heart attack? What does aspirin do for a heart attack?
So a heart attack, like I said, was when you have a blockage in the artery that supplies the heart with the oxygen and the nutrients it needs to function normally. So that blockage tends to be blood clot or platelets is what we describe. They're actually platelets, but we call it sort of a blood clot for layman's terms. And aspirin is a clot buster is what we call it. So if you have that acute clot from platelets and blood clot, you take that aspirin just busts that clot open, and it can restore blood flow to the heart and prevent long-term damage to the heart.
It's great point, great question. You know, there was a follow-up to the first question about marijuana use and about the smoke inhalation. I know you probably are well versed in this with your work with the American Heart Association. And the question is, what about vaping? We're seeing vaping seem to be transitioning to all of our kids and our youth and so forth. What about vaping and its effects on the heart?
Yeah, vaping is definitely not good for the heart. It has nicotine and some of the other things that are detrimental, as in cigarettes. We consider that to be the same as cigarettes, and we definitely recommend not starting that or quitting it if you do vape or smoke.
That's great. That's great. You know, I want to just give a moment to those watching on who are participating. If you have questions about heart disease, go ahead and list those right now. Go ahead and do it. You have an expert with you right now, and it's a great opportunity to get all of your free medical questions answered in this quick moment here. Well, I'm gonna throw a question out there that many patients will ask is, how do I know if I have heart disease? I feel good. I think I feel good. Can I have heart disease if I feel good? I mean, I run every day. I look fit. What's
Yeah.
the deal with that?
Absolutely, you absolutely can have heart disease. Again, because a lot of times, especially when you're younger, you have no symptoms. So that's why it's important to see your doctor on a regular basis and have them assess you from head to toe. They go through a history where they ask you about your family. They can elicit history about, if you have a family history of premature disease. They do a physical exam. They ask you questions about your smoking history. And all of that collectively together helps them. Oh, and they also draw blood work to check your cholesterol, see if you're diabetic and all of that. So all of that helps them draw a collective picture about your risk for heart disease. So you may not necessarily be feeling anything, but some of these things have already started. And if you're young, you don't have anything, but if you continue with what you're doing, you're guaranteed to have an event 20 to 30 years down the line. So if you know about it now and you start to work at it, you can actually prevent yourself from having this event.
Very good. Very good. All right. Well, another question is, what about, well, actually, I have one here. Should African Americans really worry about family history? What is family history, and how does that relate to the issues of coronary disease?
Well, a family history will increase your risk for having heart disease. But if you already have other risk factors, then it's just something that you add to the armamentarium. So there's some people who say, well, I exercise all the time. My cholesterol is, my blood pressure is good. I eat well. I'm not diabetic, so I'm fine. But if you have a family history of it, that allows your doctor to pay more attention to you. And maybe they will not accept slightly higher LDL numbers. They want everything stricter if you do have family history and you don't have any other risk factors yourself. So your doctor is a little bit more strict with your numbers. So that's where history is important.
Great answer. Great answer. It's a great question, the Q&A right now. I love this question. It's one I've tried to pose many a times. And the crux of it says, why is it that African Americans have higher percentages in cardiovascular disease? So in other words, why are we living sicker and dying sooner? Is it our diet? Is it genetics? Is it lack of primary health care, checkups? What's the deal?
I think it's all of that together. I know we had this panel session about disparities of healthcare in our communities. That's a big factor, disparities of healthcare. Two, just all the risk factors that tend to be in our communities. Three, we talked about trusting physicians and not going to see your doctors because you don't trust what they're going to say, not following an advice. So it's a whole lot of issues, socioeconomic status, social determinants, everything together, I think, is why we see higher death rates in African American communities. That's why it's important to have forums like this so we can educate the public about this disease and help them understand that they have the power to improve their cardiovascular health with just some simple changes. And with the help of course, our community, talked about our pastors and our community leaders who the African Americans tend to trust more so than the typical physician or what have you. So with the help of a community, we can help disseminate this information, educate African Americans so that we can see lower numbers, so we can
Yes.
the death rates from cardiovascular disease.
Yes.
It's very simple, but yes, that's So that's what I have to say.
No, that's great answer. And I think it kind of highlights really the role of the Association of Black Cardiologists in tapping into the community forum. And for events like this that Dr. Underwood highlighted earlier in the broadcast here. There is a follow-up question to an earlier one, and really about, can you discuss familial hypercholesterolemia and how that differs from just a generic risk factor of high cholesterol is somewhat of the question that's been posed.
So if you have a genetic issue with cholesterol, you tend to have, of course, higher cholesterol than normal. And the issue is, you get cholesterol not only from your diet, but your liver also makes cholesterol. So normal people have a kind of balance where their body can get rid of excess. They have genes that their body can get rid of excess cholesterol. In people who have genetic abnormalities with their cholesterol, their bodies cannot easily remove that cholesterol from their system. So they have high levels of cholesterol, and they're therefore at high risk for coronary artery disease. So in patients like this, lifestyle changes will most likely not be enough to drop your cholesterol. You definitely would need help from the medications to get your cholesterol under better control, because it's a problem with your body not being able to get rid of the cholesterol. So it's important to know, because if you have a family history of high cholesterol, then your doctor is very aggressive from the beginning on starting you on medicines that lower your cholesterol. And if you do have an event, despite being on medicines, they can escalate to the IV or injectable cholesterol medications that we have now to decrease your risk of having.
That's a great answer. I'm hearing a consistent theme from you, which is we need to have awareness and know our numbers. It seems as if it's a consistent theme. I'm gonna chime in one additional question, then go to the Q&A shortly. But really, you mentioned earlier on about our weight and about body mass index, and many times inside of Black and Brown communities, that's personal. That's something you don't talk about. That's one of the questions you don't typically ask. So how often should people be aware of their numbers of their weight? And is there a difference between ethnicities and so forth and body mass index, this relationship here?
Yeah, body mass index is very complex. Coronary artery disease, it's not just, it's not just one thing. It's like the whole picture. And we know that being overweight puts you at risk. But what we also know is that accumulation of weight around your waist is really the big problem. Whereas body mass index is just a gauge. I think the abdominal circumference is the bigger deal. So fat in your stomach is what really has the correlation to increased risk of cardiovascular care. So I think measuring your waist should help you figure out when to start implementing these lifestyle changes.
That's a great response. Question from the Q&A. It says, what about the clinical experimental trials in relationship to cardiovascular disease? What impact does that have on our treatments, et cetera, for African Americans?
We have a lot of good trials out there. We have a lot of great medications out there for cardiovascular disease that is shown to improve mortality, improve quality of life. But again, we tend to have less African Americans enrolling in these trials. So a lot of these trials are done more on Caucasian people, and the results of the trials are extrapolated to our communities. And so we don't know, we can't say 100% certainty that it works the same and they have the same percentage of decrease in cardiovascular health or decrease in cardiovascular mortality and those kinds of things. So that's why it's very important for us to be enrolled in these clinical trials so that we can know how these medications affect us and not just have data extrapolated from other ethnicities to us. And we've seen some other trials in the past that medications that worked very well for one ethnic group, you try it on another ethnic group, it doesn't really work that well. So we know the ACE trials, the ACE inhibitors that were touted as really, really good, but be not so good in African Americans. So it's very important for us to be involved in these clinical trials so that we can find medications that are just as beneficial for us as it is for other ethnic groups.
Very good, very good. Looks like, let's see here if there's one additional one. So the question, it's the statement in question says, so because of this health disparity, what can health professionals do to get greater engagement from African Americans?
Oh, that's I mean, that's a loaded question. We talk about this all the time, especially in the American Heart Association. How do we break the barriers? There's so many barriers to healthcare in this community. We talk about trust, we talk about conscious bias, just so many things. It's a long road. I think, you know, for physicians, need to understand, you know, cultural differences, understand the history of why that distrust is there, understand their conscious biases again, because a lot of times they don't even know that they're biased when they have African Americans in their offices. So I think educating physicians about these social issues, these conscious biases issues, can help break down some of the barriers. But it's going to be a long road. It's going to be from both sides, not just the physician side, but also from the patient side. The patient needs to, one, take control of your, you know, take control of your health. And if you go see a doctor, if you don't like what they say, then do some research. I mean, we have internet, we have so much resources out there. You know, if you don't believe that, you can go and look it up yourself, and you can ask questions. You know, the control. Well, I mean, it's up to you. Your health is up to you. You don't leave the hands of somebody else.
Absolutely, absolutely. I always joke and I say that, you know, finding a good healthcare provider is like dating, right? It's all, which boils down to communication. Doesn't mean that person is good or bad, but they may not communicate with you well enough to address your needs. And so you have to continue to search until you find that right provider who's going to tap in. But we have another question that's here. It says,
I like that. I'm going to use that one. It's like
it's all yours. This other additional question says, once you begin taking medications for hypertension or high blood pressure, is it possible to get off, or is this something you will likely be on for the rest of your life?
That's a good question, because that's a question that patients always ask. I mean, it is possible to get off if you implement these simple lifestyle changes, but the issue is sustaining it. You know, I mean, let's just all be honest. One of the big issues with my patients is that they can't sustain it. So if you can prove that you can sustain this for 30, 40 years, maybe you'll stay off the medicine. But we all know that we tend to fall off the wagon and all those kinds of things. But so I would say if you started, more than likely you will be on it indefinitely. But if you can implement lifestyle changes and sustain it, then you can stay off the medicine.
Absolutely, absolutely. And, you know, the questions are starting to pour in right now, which is wonderful as our time comes to an end over the next 5 minutes. I'm going to do rapid fire for you. Okay, Dr. Ubani?
Okay.
So first question, rapid fire says, how do you know which sources are trustworthy in terms of the internet?
I think you can, I know that's a tough one because there's so many websites out there that say a whole lot of things. I would say you can ask your physician to give you some, you know, high advice. Personally, I like WebMD. It doesn't tell you everything, but it just gives you maybe the basis so that you can have questions to ask your doctor. But there's so many websites that are coming out these days that address that. I would say talk to your doctor about it. Just look it up and write down your questions and, you know, discuss it with your doctor.
And I'll chime in. I'd say go to ABC site. They'll have a lot of great information there as well.
Absolutely.
The next rapid fire question, we're going to put you on Jeopardy, and we do acknowledge the family of Alex Trebek and his passing here with that Jeopardy mention. But it says, can you speak more on genetics and making lifestyle changes? I feel often we focus on genetics and neglect what we are consuming. In other words, food choices.
Food choices are extremely important. I mean, absolutely important. I think that you really need to improve your lifestyle changes. That's what, I mean, studies have shown that decreases your risk by up to 80%. So So we say genetics and what have you, but you know, if you even have the genetics, but you improve your lifestyle, you can decrease your risk for heart disease. So genetics is not the final end all for how your life is going to end up. You can change that. And so, yes, so lifestyle changes is very, very important. We sometimes say genetics again, and people who seem very healthy and they don't want to do anything to, you know, they're like, we're doing everything already. But then you know that they have this family history, which is just that added boost that you know, you really need to do it and you need to sustain it and those kinds of things. But overall, lifestyle changes helps, period.
Absolutely. New England Journal article from back in 2016 brought up a point: your DNA is not your destiny.
Yes,
Your DNA is
absolutely.
not your destiny.
Absolutely.
And studies looking at genetic risk. Another question that came through, it says, comment on distrust of traditional medications and reliance on natural medications for hypertension treatment.
Well, you know, I can't speak too much on what do you call it?
Natural.
Yeah, natural. Yeah, I mean, I'll be honest with you, in medical school, we don't get trained on, you know, natural remedies for, I don't know what you mean by when you say natural remedies, I'm assuming you're talking about herbs and those kinds of things. But I'll be honest with you, in medical school, we don't get educated on natural remedies. So I wouldn't be the person you'd be coming to ask about natural remedies because I can't answer that question.
Yeah. No, I'll chime in briefly that, you know, I think one of the key things to remember is that there's risk and benefits of everything. And that even inside of nature and some of the potent foods that are there can be an adverse effect from ingestion. Poison ivy is natural in nature and it can lead to adverse effects. And so we have to be very diligent and wise in looking and relying upon communication with our healthcare providers. But another question that's come through, and this one stemmed from Facebook Live. So we welcome those on Facebook Live and continue to join us in as we broadcast here. It says, are appropriate weight levels different? So this is really getting into weight differences between African Americans and other ethnic groups in terms of BMI, you know, in terms of, hey, should I be more concerned or less concerned because my weight is different than other ethnic groups, Asians perhaps, or Caucasians compared to African Americans?
So that's a difficult question because there's, you know, we don't have any strict guidelines saying this is the way you should be. We just overall say you need to, I mean, BMI is a guideline, you know, the weight that's considered normal under BMI, you may not necessarily be able to get there, but losing even a small amount of weight can improve your cardiovascular health. So you should just attempt to lose weight. I mean, nothing too drastic, but attempt to lose weight and just do the best you can to get your weight down. But there is no number that I recommend. If you weigh 190 pounds, I say try to lose 30 pounds, you know, just lose something. And that goes a long way in improving your health, as opposed to giving you a number, and this is a number you need to get to. That's unrealistic.
Very good, very good. I think that concludes our question and answer period there. Thank you so much.
All right, well, thank you, thank you. So we're gonna move on now to our next session. I think Dr. Columbus Bautista is gonna be giving the next talk, and this one's gonna be very exciting because I love to hear Dr. Bautista talk. His talk is going to be about it says the CATH Lab, cooking alternatives to health. Just a little bit about Dr. Bautista. He's a board certified interventional cardiologist and assistant clinical professor at the University of California, Riverside School of Medicine. Since 2008, he's served as the chief of cardiology at Kaiser Permanente in Riverside and Moreno Valley. And over the years, he's been recognized for work by multiple organizations. In 2011, he led in establishing the Integrative Cardiovascular Disease Program, which sought to prevent recurrences of cardiac events through lifestyle interventions. In 2018, he worked with Samsung Electronics to develop technology, virtual cardiac rehab lifestyle programs, and successfully treated over 5,000 patients via virtual care delivery. He is very active in nonprofit organizations like the Heart Health Nation to share information about the benefits of plant-based nutrition, daily exercise, and stress reduction. And he's currently collaborating on an initiative to create a docuseries entitled Slave Food, which explores the relationship between stress weaponization of food and health disparities in the minority communities. So without further ado, I want to welcome Dr. Columbus Bautista. He's one of our experts on nutrition and its benefits in cardiovascular health. So we are very excited to have him talk to us today about nutrition and how it benefits cardiovascular health. Here we go, Dr. Bautista.
All right, good morning, good morning, good morning. It's a pleasure to be here with you all today, and also to have the pleasure of following Dr. Ubani and her excellent talk. I definitely have enjoyed it thus far, but let's dive into things here this morning. Before I kind of get into the CATH Lab and the particulars of it, which stands for Cooking Alternative to Health, I want to kind of start with, I was out for a walk this morning with my wife and kind of getting a little bit vitamin D and a little exercise, all of the key components we spoke about. And I remember we were talking about my nephew who had this thing called a gender reveal. Now I have kids. I have a 14-year-old son. I have a 15-year-old daughter, and I don't ever remember having any kind of gender reveal party. And what's interesting, as she was explaining this concept of a gender reveal, is that there's a few people who actually know what's going on. They know the secret that's there, but everyone else somehow has forgotten or doesn't know. And so in this particular instance, my nephew, congrats to him, is having a son. And there was other gender reveal parties for those here inside the Southern California area that actually resulted in catastrophe. And so one of the things that we have found is that 2020 also had this big reveal for us, this big secret. We go into every year and we have no idea what's in store for us as we turn the corner into 2021. But last year, this time, as we turned the corner into a new decade of 2020, we were struck with the perils of the coronavirus. Never before seen, COVID-19 was never before seen. And when this landed, when this struck, it's led to devastation. It's what we've seen continually here. Studies have now shown that we're now over 10 million cases inside the United States. Over 244,000 individuals have been struck with the coronavirus. This coronavirus has unleashed a secret, this plague upon the earth that we haven't seen in recent history. And one of the things too as well that has come as a result of all of this is we've seen that Americans seem to be disproportionately affected by the coronavirus. Studies have actually shown that Mayo Clinic reported years ago that nearly 70% of Americans take at least one prescription pill. Studies have shown that America is disproportionately affected by the coronavirus. And as the relationships have come forth, we see that it's related to the things Dr. Ubani spoke about in terms of obesity or size, in terms of chronic disease that's associated with cardiovascular disease. And as a matter of fact, America, we think with all of our technology as this race to develop a vaccination is on the midst with us, that we think that we have all this technology and we should not have cardiovascular disease or heart disease or any other chronic disease burden. But what studies are showing is that America has some of the highest chronic disease burdens out of all industrialized nations, that America is indeed living sicker and dying sooner. That studies have shown that nearly 60% of Americans have at least one chronic disease. That means high blood pressure, diabetes, high cholesterol, cancer, some type of comorbidity, that 40% of Americans have at least two or more chronic disease burdens. That we're seeing that this is pervasive throughout society is what we're seeing as it relates to this chronic disease, that we're seeing that we're obese, we're a growing society, not in height, not in stature, but in width is what we're seeing, that our diameters are increasing exponentially and we're leading the world in the wrong way. And this is showing itself and manifesting in 2020, this secret that's always been there. We've always known this, our disease burden, but it's making it real to us in this particular instance. 2020 has been indeed something that has shown us that we are diminishing our health span. So often I meet patients who say to me, Doc, I've lived a good life. I'm okay with not living forever. It's not just about your lifespan, it's about your health span. How long can you live healthfully, living a life of purpose, enjoying your family, traveling, even before the COVID period of time? What studies are showing is that the health span of Americans is truncated. We're seeing that we're now bound to medications earlier in life, that we're now bound where our social calendar becomes revolving around doctor's appointments as opposed to social and life events. We're seeing that despite this, that in the midst of this rather, that Americans have some of the highest burden of avoidable diseases, deaths from this. That once again, we're living sicker as Americans and we're dying sooner from avoidable, as studies have shown from the Centers for Disease Control, that 7 to 8 out of 10 of the top killers are preventable through lifestyle. Many of the things that have been mentioned throughout this entire presentation here today is what we're seeing on a consistent basis. And along with this, we're dying in general sooner than other industrialized countries as we look globally around the world. And this is problematic. And so we're dying, but yet we're spending more money. We would look at our gross domestic product and the percent of money that we spend on healthcare, on technology is exponential. And so the real secret is not just this. There's another secret that's there. Another secret, there's a dirty little secret that has not been known that the 2020 has really brought about. And it's told us that within the confines of America living sicker and dying sooner than other nations, that there's a subset in the Black and brown communities that are living sicker and dying sooner. They're living in the land of the free, home of the brave, sicker and dying sooner than any other group. And that's the African American and Latino communities, is what we're seeing consistently here. Studies have shown that even as COVID, which has been the great reveal inside of all of this, it's shown that the death rates are nearly double the national average inside of the African American communities, inside these Black residential communities is what we're seeing here. That we're seeing the African Americans, as Dr. Uvani brought up and many others have brought up, that 50% more likely to die, to have heart disease than those who are Caucasian, more likely to die at an early age from any cause. And as well, not being able to afford a doctor, nearly 20% unable to afford a doctor's visit. That we're seeing not only these things that of those preventable deaths across the board, when we look at actuaries, right? So life insurance companies, when we go to Vegas and people gamble and things of that nature, they're saying the odds on who's more likely to win the Super Bowl, the NBA championship, or whatever it may be, my Lakers, by the way, congrats to them, versus other people. They find that across all 50 states, who's more likely to die sooner from preventable causes? It's African Americans, the blue dots at the top of the graph there. So why do Americans die sicker and sooner than people in other countries? Why do African Americans? I pretend it deals with stress. Stress. It's simply stress is what we get to. That stress equals demands minus resources. And you know what I mean by that. If your bills are $1,200 and you have $1,000 coming in, that means that you're now stressed out because your resources don't meet your demands. If you need to pick the kids up, pre-COVID, of course, at 4 o'clock, but the boss wants something by 4:30, your demands exceed your resources. That you become stressed and it triggers this cascade throughout your whole entire body that mimics an elevated blood pressure state as the vessels begin to crimp down. It mimics a diabetic state as your blood, as your pancreas and liver rather begin to mobilize the blood sugar. That it mimics these things that prepares you for fight or for flight, but when it's chronic and unresolving, this leads to a disease manifestation. We become one nation under stress. Is what we become. Studies have shown this. American Psychological Association shows it's not just us as adults, it's our kids. I remember talking with my kids and saying, hey, listen, what do you have to be stressed about? Daddy has to go to work and has to pay the bill, but our kids are stressed. Our Gen Z is stressed about the future of work as my niece is looking for a job as we're now in shutdown mode. They're concerned about money. They're concerned about the health of themselves and their family as they're entering this phase of life. Is what we're seeing on a repeated basis, that parents are stressed out. They're stressed as their level of perceived stress is high, trying to balance out work and space and with the kids at home and working virtually and remotely. There's stress that abounds all about us is what we're seeing on a consistent basis. We're seeing that there's also stress related to, will this economy last? What's going to happen? What's going to happen on the political front? The searches in Google, people love saying Google me now, right? When you use the Google searches have been a reflection. Studies have shown that anxiety or stress related searches are at an all-time high right now during this pandemic. That kids are saying that social media, the Twitter and the TikTok and the Facebook, that you think it's an area where they can kind of get support, but nearly 40%, 2 out of 5 feel as if it makes them more sad and depressed afterwards. Our physicians are stressed. There's something called empathy fatigue that doctors, we've heard the tragic stories of doctors committing suicide, taking care of on the front lines of patients during this coronavirus, that our world is stressed, our providers are stressed. We spoke about these things that are here, that I want to tell you today that your health is tied to your stress, that your health equals your resiliency divided by your stress. In other words, the higher your stress, the poorer your health. The higher your stress, the poorer your health. We have to work on building our resiliency to offset the stressors of life that are persistent and are always there. That's one of the key things that are important. And so studies have shown, you still don't believe me, that stress is distinctly related to disease risk. So studies have shown, and this is interesting, this is actually a forbearing kind of study from 2001. It said that people who have poor social supports, limited social networks, are at increased risk of disease. That means for individuals who are socially isolated. These are individuals who are out there by ourselves. 2020 has revealed this even more as we're seeing this burden. I'm seeing patients present at a much higher burden of disease risk when they do come in finally. That studies have shown perceived stress, not even if it's real or not, just if you perceive it, if you think it, the level of risk of cancer increases. We see that when you perceive stress, when they isolate stress as an independent factor, it is predictive of diabetes. Predictive of diabetes, irrespective of socioeconomic status or body mass index. Stress can play a role, how you perceive life events that are going on. We see that stress in heart disease is related, not only for coronary heart disease, but we're seeing an increase, studies have shown, of something called a broken heart syndrome. Stress-induced cardiomyopathy, where an individual is confronted with just an unrelenting amounts of stress that it causes the heart to paralyze, no longer to contract. And studies out of Cleveland Clinic have shown an increased number of reported episodes of this thing called the broken heart syndrome than any other time since 1990, when it was first described during this indeed this pandemic that we're seeing. We see the same thing with stress and with stroke. We see a relationship with these things. We see stress and Alzheimer's disease or memory impairment as we grow older. Stress, our perception of how we respond to life events, is important and plays a substantial role. That yes, indeed, our health equals our resiliency divided by stress. So the question came up earlier, it says, essentially, why do Black people in America die sicker and sooner than other people? I say it's stress. Because it's not only that stress burden that's there, but there is also a unique stressor that 2020 has brought out. Remember, I told you that in this gender reveal, people know what the gender is. They know that there's an underlying situation that's going on here, but to others, they perceive it as being a secret. And what studies have shown is that there is a unique stressor that Black and brown individuals, people of different sexual orientations, may face on a consistent basis that others do not, and that is that of racism. And that's what 2020 has uncovered. It's uncovered the issue of this social unrest that's come up as we've seen pictures and videos of atrocities occurring, of individuals who may look like us, that bring about memories of things that have happened either to ourselves or to loved ones that we hold dear and true to us, and eliciting a subconscious struggle and fear that's deep rooted there. Now, the stress, you may say, well, that's just stress. Well, how you measure? Well, many authorities out there, the David Williams and the Monty Allens from Berkeley and from Harvard, what they do is they've done research, and it told us that racism is equal to stress, and that individual women who said they faced racial discrimination were more likely to develop breast cancer, just coming out of October and Breast Cancer Awareness Month. That studies have shown us indeed that when we see a relationship between high perceived stress, then we're seeing blood pressure at all-time high. Dr. Underwood wrote a great editorial on this inside one of the the journals that was there, and we spoke about the perils of unchecked high blood pressure. We're seeing that this relationship, that racism and stress, there's a relationship between carotid artery. That's what feeds the brain. That's what leads to strokes, that there's a higher incidence in individuals who suffer with racism. Yes, indeed, the higher our stress, the poorer our health. The higher our stress, the poorer our health, and our health is indeed tied to our resiliency divided by stress. And what do many of us do when we get stressed? Well, I've said this in time it's gone past, is that we turn to a double date at times with a Ben and a Jerry's, and we tend to go and we bury our sorrows inside of our food. That yes, indeed, our stress is tied to desserts. Stress is dessert spelled backwards. And many times we turn to food as a source of relief, a source of medications to offset the burden of life, something that's accessible, that's acceptable within society. And it's what I characterize as nutritional stress. So in our attempt to build resiliency, we're actually contributing to the stress through what I call nutritional stress. What is nutritional stress for you out there? Nutritional stress is what I characterize is not just eating disease-forming foods, right? We all know what those disease-forming foods are. Come on, we know what those disease-forming foods are, but it's also the absence or not eating health-promoting foods. That's the key, is what nutritional stress is. We're adding to the stress instead of the resiliency, and that's what leads to the problem. And so once again, I say the greatest threat out there, it's stress. And a core component of what we can control is, number one, our response to stress. We can either have a stress fear response that evokes the stress cascade, or we can have a challenge response, like a LeBron James who seeks out the ball in the last minute, like a Emmitt Smith who wants the rock as he wants to run the ball at the end of a football game. We want to seek out that's a challenge response, and it builds strength in our body and helps resiliency to occur there. But what's the greatest threat? It's stress and nutritional stress. Nutritional stress, and as a matter of fact, CNN did an article and study the same poor diets threaten the US national security, and it's serious. And why is that? Well, because we're seeing this increased burden of obesity, this increased burden of nutritionally related, that we're having difficulty and even drafting or enrolling individuals into our armed forces because of their body mass index, because of the limitations in terms of their healthful outcomes that are there. We live in dinner tables that look like this, filled with highly refined processed foods, and oftentimes folks get into this battle over a diet. A diet stems from the Greek word dieta. Dieta is a term that refers to an overall lifestyle, a sense of well-being. It's one component of a lifestyle that feeds each other seamlessly. As we look at mind, body, and spirit is what it ends up. And so we have individuals who are living inside the standard American diet, or what I call the deadly American diet, right? Studies have shown full of salt, sugar, and fat. And once again, what has 2020 done? 2020 has really revealed our reliance upon these nutritional stressful foods. As we've gone back to comfort foods, as Americans now troubled over the politics, troubled over social injustice, troubled over the future, they said, I just want a little comfort. I want something that reminds me of times gone by in the past. And we're seeing comfort foods on a rise, our childhood foods that are on a rise, where it melts in our mouth and not in our hands. It doesn't require much chewing because it's so heavily processed and refined, filled with salt, sugar, and fat. And oftentimes you get people, talking heads like myself, who say, you think you have a choice, just make better choice. You have a better choice. But the question is, do we, as we live, many of us, in these communities filled with weapons of mass destruction? Dr. Ivani alluded to this when she spoke about social determinants of health in one of the answers. I grew up in Compton, California. I remember my father having to travel many, many miles, 20 plus miles, to go just to a grocery store that had fresh produce, a grocery store that had affordable, reasonable items for our ingestion. And studies are confirming more and more around us, telling us that just if you live in proximity to fast food restaurants, our increased risk and burden of heart disease goes up, is what we see, that the ingestion of these foods is distinctly related. That if we look at subsidized foods, right, that are going to be rich in sugar, refined sugars, rich in high fructose corn syrup, and the sugar, the fats of the meat and things of that nature, that there's an increased risk of what's called cardiometabolic syndrome. That's where you have this fat deposition on your organs. There's another way you characterize it as TOFI, thin on the outside, fat on the inside. The issue is really that abdominal or the stomach related size and fat, and that's what was spoken about in the prior segment. Oftentimes, many of us, we say it's easy, just make a change. It's so easy, but we're addicted. Or we crave. We don't like using words like addicted. We say we crave these foods. We desire these foods. They're enjoyable to us, and so we continue on in these foods that are rich in salt, sugar, and fat. It's what we continue to do on a regular basis, but these foods create stress in our body, as I alluded to before, that I told you about the surge, that the salt that we all love, right? So whether or not it's the theory on salt sensitivity gene that may heighten the burden of blood pressure elevation, that may, we all know, if you have too much salt, it may make your feet swell a little bit, right? And you ask the doctor to give you some water pills to help get the water off. How about we just get rid of the salt? That how many of us know that just 1 teaspoon of salt is 2,000 milligrams of sodium, more than what you need on a particular day? That salt impacts everything, not just the blood pressure, but it can impact what were called the endothelial cells, the lining of the vessels that stem from the head to the toes, and can lend itself to many disease states. Well, we know that salt is a key component. We know that sugar plays a role. I don't mean the sugar from blueberries and raspberries and strawberries and pomegranate seeds. I don't mean the sugar from watermelons and from apples and oranges and bananas. I mean sugar that comes in this white powdery substance. I mean sugar that's processed and refined that you can pour onto your tongue, or that may be masked under many different names on the labels where it's hidden from you. That this added sugar has been shown to be detrimental to your body in general. As a matter of fact, studies that were done looking at the incidence of cardiovascular disease showed substantial increased risk of cardiovascular disease with this recurrent ingestion of sugary foods. Are we reading the labels? Are we aware of what we eat? Or are we just relying upon how we feel and the way food tastes in that particular moment? We look at the fat. Fat plays a role, and so it's not just the fat. Oftentimes there was a theory that came out in the 1950s saying that meat is bad and this is bad and the other. What we know is that there is value in plant protein. People say, Doc, I need my protein. I need my protein. And so I want to let you know today that there is rich protein in many, many items, specifically inside of your whole grains and your beans and legumes, that can afford your body the ability to fight this thing called disease and increase your health span. Studies have shown, as we look across the board, it's been repeated consistently that the more plant-rich protein that we ingest, the better our longevity is, the lower our burden of disease is. Across the board. And what do many of us do when we get ready for that nice, some of us are planning on Thanksgiving and want to deep fry that turkey. We come out of Labor Day, and what we do, we put it on the grill and barbecue. We want those grill marks. We want the crisp. We create something, we age. We get these things called aging, advanced glycation in products. That's this thing called the browning. You get that crisp edge. And the same thing happens on the lining of your vessels that will ultimately lend yourself to coming and seeing myself or someone like me. That this thing called advanced glycation in product is predictive of diabetes and cardiovascular events and obesity alone. It's a reaction that occurs between the sugars and the proteins from this increased risk. And that's part of the problem from some of the animal products in which we eat, potentiating cancers, potentiating cardiovascular ailments from the foods that we're eating. We look at, it's once again, it's not just the fat. What we're finding is that we know studies are telling us more and more. There's a term out there many of you may not have heard of. It's called the microbiome. And this microbiome, it's a reflection that we're actually more bacterial DNA than we are human DNA. How many of you knew that out there? We're more bacterial DNA than we are human DNA. And every action that we do, the way we choose to think, being active or inactive, but most importantly, our food can predict what type of bacteria are in our body. Are we feeding the good guys or are we feeding the bad guys? And studies are telling us that when we eat certain animal-based foods, it can stimulate the carnitine in it, which is part of the animal source. And carnitine can be found in many substances, but it's more at an increased level in these animal products. It can generate this thing called trimethylamine oxide that then lends itself to more progressive atherosclerosis or hardening and infiltrative cardiovascular disease. So we're seeing this. It's not just the fat, it is indeed the choices that we're making in terms of the food substances. We have to crowd our plate out and add foods in that are fiber rich that will feed the good bacteria, that are rich from a plant rich source, which are the only components of that. So what happens as a result of all this nutritional stress? If I told you that your health equals your resiliency divided by your stress, and nutrition adds to this stress, we're seeing globally that as we have branched out and spread the standard American diet throughout all of the world, we're seeing an increase in non-communicable diseases. Now, COVID and coronavirus is a communicable disease. You can breathe it. You can have different aspects that lend itself to it. But non-communicable means that you cannot catch it by coming in close contact with it. It means these are things that are lifestyle mediated, that may be in part genetic mediated too as well. And we're seeing the increased risk globally as a result of the lifestyle and the spread of from an industrialized perspective. So what's the secret to success as it relates to this? The secret to success, I always say, is being selfish. Now, the Association of Black Cardiologists has their top 7 things. I have my top 7, and I say you need to be selfish in order to live a life of purpose. You need to be selfish to counteract this thing called disease and heart disease. And what does selfish stand for? The S in selfish stands for being spiritual. That means moments of gratitude, being thankful, even amidst like all of the storms of life that are having, finding 1 or 2 things a day to be grateful for, being moments for meditation. Huge power in building your mental fortitude and willpower has been shown regarding meditation and prayer. Those are extremely powerful. And so I always recommend taking just a few moments. What does the E stand for? The E stands for exercise. Now, I don't mean that you have to get, and Dr. Ubani brought this up in terms of vigorous exercise versus not, but I always tell people at least get neat with it. What do I mean by neat? Non-exercise activity thermogenesis. That means that when you're just standing and chopping, you're burning calories. That when you're just walking up and down the stairs, that means instead of driving for hours to find a parking space, park further away and walk in. Non-exercise activity thermogenesis. What's the L stand for? Love instead of hate. It's so easy right now in our society to choose hate. But when we embrace love and we get the antidote towards stress, which is oxytocin, that our vessels begin to dilate, our heart can begin to repair. Small studies have shown that we also have this need to tend and befriend, which is the antidote to the fight or flight. Choosing love. The F stands for food. Real food, whole food, food that makes you chew, food that it wasn't made in the plant, but it's comprised of plants, foods that our great-great-great-grandparents would recognize. The I stands for intimacy, right? And I don't mean that in a sexual way, but I mean someone that you can convey your thoughts and emotions to. The S stands for sleep. We ignore this all too often. As we sit on social media and our computers and we're connected constantly and sleep is diminishing over and over. We have to engage in getting good, healthful sleep on a consistent basis to lower our stress burden. Here, I'm gonna give you a trick here, right? What we know is that when a person doesn't get enough sleep, their hormones get thrown off, and their ghrelin, which is a type of hormone, think of the hunger hormone, is increased. We all know what happens. You get the munchies the later you stay up versus and so that's what becomes important about getting your rest. The H stands for humor. Finding moments in life to laugh becomes important. And what happens when you do this? What happens when you engage in this overall lifestyle mediated? Well, studies have shown, the question came up earlier, can I get off some of these medications? Is there hope? You have to choose hope over choosing fear. And when you choose hope through lifestyle, studies have shown, small studies, that 82% of participants showed the slight improvement in blood flow by choosing a whole food plant-based diet with exercise, stopping smoking, and decreasing stress. This study was repeated out of India in the Mount Open Abu study that was done. There's power that's there. Studies that have done epidemiologic, which means we just observe individuals, have shown, done out of Loma Linda, California, show that as you begin moving from eating any and everything, the orange bracket, down to eating a plant-predominant diet, foods rich in fiber, that all of a sudden your diabetes seems to improve. That as you begin to move from eating any and everything down to a plant predominant diet, the cholesterol levels begin to decrease. As you move from eating any and everything down to a plant predominant diet, the green bar, we see blood pressure levels seem to improve. And these studies have been replicated through the Lyon Heart trial, looking at Mediterranean style diet, which doesn't mean pizza and pasta. It means rich in fruits and vegetables and whole grain, replacing some of the fats with olive oil is what that means. Now, oftentimes, many of you out there may say, Doc, I know this stuff already. You're not telling me anything I don't know. Well, that's why there's a great philosopher I followed ever since I was a child. His name was Bruce Lee. And Bruce Lee said, knowing is not enough, we must apply, right? We have to apply what we say we know. It's time to stop just saying we know. You have to stop saying, I'm willing, okay, I'm gonna start tomorrow. I'm gonna start after the holidays. I'm gonna start in 5 weeks. Willing is not enough. We must do, not tomorrow, not next week, but today we have to go ahead and do. That's what becomes important. We have to be willing to do. I want to take time, and right now we're going to show you a little blip. How do we do this? That's what the CATH Lab is. So one of the things that's been a part of that I've cherished is what we call the CATH Lab. And the CATH Lab is the cooking alternative to health. You come to the CATH Lab to see me when you're in the throes of having a heart attack, and my job is to help stop that. You come to see me when you're having refractory bouts of chest discomfort, and my job is to stop that. Well, our CATH Lab is another venture where what we're looking to do is change the paradigm from your plate and from your knives.
Spirit of the Heart, welcome to this special online edition of the CATH Lab, Cooking Alternative to Health, with yours truly, Columbus Batiste. I'm one of the local interventional cardiologists and a proud member of the Association of Black Cardiologists. You can find me on Instagram and on Facebook at thehealthyheartdoc.com as well. You know, one of the things that I love to do with my patients is I love to host a cooking class. The ultimate extension of care is really showing folks how they can live healthier, how they can live with less stress, and build more resilience. So one of the things we love to show and demonstrate is the bowl method. Very simple. So what we do is we do a no cooking class, and what that involves is buying frozen rice and canned beans and frozen corn and packaged lettuce, because we want to make your time is precious and it's valuable to you. So as we start our bowl, one of the first things we do is we choose our grain, our rice. Now some may choose white rice. Brown rice is going to have more fiber. Red rice along with barley. That's what this is a mixture of. This here is a mixture of red rice and barley and brown rice that's fiber packed and rich. Now you add that to your beans, and your canned beans, you want to look for the no salt label on the can, BPA free can, and you can choose the bean of your taste. Black beans, red beans, pinto beans, whatever the choice. But when you combine these two together, it's power packed. It's going to be rich in protein to rejuvenate your body and help you fight off the toils of life. Now I love adding in next a little bit of corn. I like roasted corn because it gives me that robust flavor that I long for, that I'm used to when I ate a little bit less healthy. Now you can never, ever, ever not add in your green leafy vegetables. That is the key to success, because these dark green leafy vegetables, the mixture of kale, the mixture of green leafy leaf lettuce, as well as your cabbage, the cruciferous vegetables are going to add a power punch to your endothelium. It's going to help the lining of your vessels expand better, giving dietary nitrates to it. It's been shown to help breast cancer patients too as well when you engage in cruciferous vegetable intake. So there's so much power. One of the things we know is this month is Movember. And then Movember is what? It's a recognition of men's health, prostate cancer, testicular cancer, and mental health. And we know that things like salsa with the tomatoes that deliver lycopene, it's extremely helpful in prevention of prostate cancer. So we want to load up on good things like this and add it to your flavor of your palate. Now, most of us will typically add in sour cream and cheese and ranch dressing to our meal, and that may make it slightly less healthy. Now, what I love to do is I love to add in a nice, rich hummus. And so you can get the hummus of your flavor. It can be jalapeno and cilantro. It can be chili. It can be plain hummus, because hummus is just simply ground garbanzo beans with a little bit of tahini, which is a type of sesame seed that's together. Now these will give you additional benefits by adding in the beans. So let's get at this and just add some of these things together in our plate, and we make a quick bowl. I call it the healthy heart top bowl. It's very simple. So one of the things first, we get in our rice, get that rice inside of here. Oh yeah. Comes in there nice and sits in there. Next thing we're going to do is we're going to add in our beans. And remember, like I said, you can add in any type of bean that you choose. For myself, I love the black beans. It makes it very simple and easy to eat. I love it. Gives me power-packed nutrients. The corn. I get in my corn, gives me that color. The more color that you have, the better off it is for you as things start to kind of come together. Now, what I don't have in the house today is I'll oftentimes add in red peppers, my grilled peppers, which are going to give it additional flavor. Now it's time for our green leafy vegetables, and you just pour in as much as you can, as you want on here. This is power packed, and now oh, isn't this beautiful? Look at this, the colors are just popping. Now you want to top this off with what? Top it off with a little salsa, get those lycopenes going on here. And man, my mouth is watering right now. I'm gonna get this on here. I know you guys are anxious. You at home, go ahead and try this. My hummus on top. It's beautiful. It's beautiful. Ready to dig in. Made specially for you. This took me all of a minute and a half. No cooking, minimal cleanup. You can have fast, healthy meals ready for you without cooking, without stress, to really transform your body. I hope you enjoy the rest of this program, and it's been nice connecting with you. Take care.
All right, that guy's pretty good. I don't know who he was, but he's pretty good. But we appreciate that. Dr. Ubani, I don't know if you're going to join us in now.
Oh, yes. Oh, okay. Well, thank you for, you've completed your talk? Awesome.
Yes. For more information, you can always kind of follow. Once again, ABC is the #1 spot that's there, but there's some other options to kind of follow and gain more information about some of the information I presented today.
Awesome. Thank you so much, Dr. Bautista. You know, I love watching your videos on nutrition. I always seem to learn something new. I think that the advice that you give patients is excellent. It's very practical and it's very simple, and the food looks delicious. Thank you again for sharing this information with us.
Absolutely.
We'll go on to questions. Audience members, please feel free to add questions into the Q&A box or the chat box for Dr. Bautista. If you have any questions, let's go to the chat box and see if we have any questions there. We have one question for you. So this is from Lavana Lewis. She says, with the increases in food insecurities, how can we help people make less expensive, healthy choices?
Yes, well, I mean, that was really the point. Great question. That's really part of the issue. I always recommend to folks, you don't have to shop at an expensive grocery store. It can be your Walmart, it can be your Target, and you're looking for frozen foods. Why frozen? Well, because it won't decay. And so you can get your frozen, 99-cent store actually is a good resource for some of the frozen foods and some of your canned beans that you can add and create burritos. You can have potatoes, you can have many different things that are health promoting for you. So I think that's one of the options that are there. I think you have to make a conscious decision about your choosing to eat healthfully, and recognize that when you eat out, it's going to be more costly than when you eat in and you purchase from a grocer of any sort.
Awesome, thank you for that. Can you just give us a link to your videos one more time? I think people are curious and would like to go on later on and look at some of these nutrition videos that you have out there.
Absolutely. So 2 sites. One is thehealthyheartdoc.org. The second site is slayfood.org.
Great. We don't have any additional questions. Actually, I do have a question that some of my patients tend to ask me. I know that you promote protein-based diets, because there's lots of literature supporting protein-based diets when it comes to cardiovascular health. But people always ask me, but there are some nutrients that you find in animal foods that aren't in protein foods, correct? And what do you do about that? How do you supplement and make sure you're getting all the adequate nutrition that you need?
No, that's a great question in terms of plant-based foods compared to animal-based foods. And first, I'm gonna tie in that, and then I'll trigger for another question I saw come through about how do we introduce change to the diet slowly in patients. So one of the things is that we know is that there's a fallacy in terms of incomplete protein, and that's been debunked for many years, but yet this inaccuracy, for lack of better terminology, that's fake news, persists even to this day and age, that yes, indeed, we are able to get the adequate amounts of protein from a variety of plant-rich sources. So when we combine things like the staples of across all populations, beans, grains, corn, things of that nature, they are the most long-lived individuals are called blue zones around the world. And there's actually about 7 or so blue zones around the world which reflect the longest lived. Those are all centered around a plant predominant diet. That yes, indeed, not only are you getting adequate amounts of protein, right? That we don't live in a society with protein deficiency, but you're also getting phytonutrients and macro and micronutrients that are really helpful for preventing disease. As an example, one of the things that we're seeing a lot more and more is we're seeing the role of things like zinc from your legumes, from like the beans and the seeds. We're seeing things like quercetin that you get from the skin of like your fruit, berries and so forth, along with resveratrol, those playing a substantial role even in the ability to arm the immune system during this stressful period of time. So there's power that's there. So that's something, it's a matter of intention and balance. In terms of for patients who are looking to make a change slowly, one of the things is I say that we have to make smart goals. We have to be very specific with measurable amounts that are achievable and reachable targets that are there. And so what do I mean by that? Well, if you're going to choose fruit, what type of fruit? Don't just say I'm gonna eat fruit today. Be very specific. I'm going to have a half of an apple. I'm going to have blueberries. I'm going to eat a certain amount. That be very specific to your vegetables. I'm not going to just have vegetables. I'm going to specifically have today romaine lettuce, and I will have an amount that's achievable, half of a cup. That's a day. And what I recommend to folks is get the calendar method. We're going to go back to school like we're in kindergarten. We're going to get a rewards calendar. And what I want you to do is to put an X on the calendar every single time you're successful. And that's where it becomes important.
Awesome. Thank you for that. I completely agree with that. Awesome. We have time for just one more question. I think we have 1 minute left. We'll just take one question. And the question is from Adam Porter. And he asked, how do you think about sweet potatoes versus regular potato pasta versus wheat pasta? I guess sweet potatoes versus white potatoes.
So first I'll say this is that potatoes are not the enemy. Potatoes are great for you. People oftentimes villainize potatoes. It's not the potatoes that are bad, it's the stuff we add to them. We add butter and we add marshmallows and brown sugar to the sweet potatoes, or for our regular potatoes, we're adding sour cream and we're adding bacon and we're adding cheese on top of it. And we wonder, well, this stuff is bad for me. Or we take those good hearty potatoes and now what we do is we deep fry them and soak them in heated oil that's been transformed and carcinogenic. And we wonder, why am I gaining all this weight? And we sprinkle salt on top. But the potatoes themselves are not. So I say transform the way we think about potatoes and not look at them as the enemy, but let's transform and put health promoting things on top. Let's put in beans or chili. Let's sprinkle on top a little hummus for flavor. Let's add in broccoli and all the other situations that are there. And you will recognize that you will enjoy it and you will not gain weight, but you actually maintain and lose weight if that's your goal. There. So those are some of the things. In terms of the pastas, all pastas are going to be refined. So you want to look at really the type that's going to be less likely to trigger the blood sugar to shoot up sky high. And those are the things that are going to have more chew factor in it. If it makes your jaws tired from chewing, it's rich in fiber. If you put in your mouth and it just starts to melt, you know you're probably not eating the right thing in that particular moment.
Thank you again, Dr. Bautista. That's all the time we have, but thank you for that very informative lecture that you have.
Appreciate it. All right, well, we're looking to kind of change our focus and our attention. We've all been kind of sitting down for a while, and I I alluded to somewhat the importance and the power of movement and activity. So it's my honor to introduce our next guest who's going to lead us in a stretch break. And one of the things I recently came across a study that actually showed that just stretching, so if you did no other exercise except for stretching, that it's been shown to help your vasculature. And individuals showed improved vascular function just by stretching. So if I stretch my legs, it didn't just show a benefit in stretching the legs, it also showed a benefit inside the arms and other vessels inside the body. So there's power that's there. So it's my pleasure, distinct pleasure, to introduce Carolyn Long. And Carolyn Long, she graduated from the University of California at Fullerton back in health and fitness. And she's been in the fitness industry for many, many, many years now. So she is indeed an expert inside this area here. Her journey has led that where she's worked in fitness centers, she's worked as a nutritional counselor, and currently right now, she is the fitness director for Edwards Life Sciences in Irvine, California. She's been there for nearly a decade. She is an author. Man, I'm amidst all these authors, I'm feeling a little bit incompetent of it's time for stretching. It's time for stretching. And one of the things I loved about what her bio says is that she speaks about some of her favorite things are just what we spoke about, time with her family, her daughter, her dog, Peanut. She loves shopping and watching movies, all things that are helping her to get selfish in life. And she says her motto is always have fun. So happy, Carolyn, I'm looking forward to having fun during this stretch moment.
Good afternoon, everybody. I'm Carolyn Long, and thank you so much for asking me to join you today. I'm just going to adjust a little bit. Okay, we're going to work on some stretching. And one of the first things I'd like to do is to have everybody stand up and make sure you have some room so you're not going to hit anybody or anything around you. So the first thing is stand with your feet apart, keep your knees slightly bent, and be in a comfortable position while you're standing. So what we're going to do is let's take a deep breath in. So let's inhale through your nose and exhale through your mouth. Let's do it again. Inhale and exhale. One more time. Here we go. Inhale, big stretch here, and then exhale and relax just a little bit, not too much. We're going to start with the shoulders. So we're going to circle the shoulders. You take them up and around, circling. All right. And then from here, we're going to take those shoulders forward and reverse. And focus on the shoulders, not so much the arms. The arms will just go with what the shoulders do. All right, now with the arms down to your side, hands here, you're going to bring the shoulders straight up, push down low, up, down, lift, lower, up, again, lift, lower, and we'll do it again and hold this time. So you're holding, push down those shoulders. I'm going to ask you to take your hands behind you. And from here, you're going to take your head and you're going to turn from one side to the other. Look over the shoulder, stretch, stretch, nice and easy, not too fast, because you do want to feel the stretch every time you look over the shoulder. And again, and let's do 4 more. 4, 3, 2, and 1. All right, and then from here, let's take your head, and this is a new one for a lot of people. This one helps with loosening up the muscles right through here, up and down the neck. It's called the chin tuck. It's going to look funny, but your chin goes back like this, and then you relax. So it goes back, center, pull, relax, back, center, back, center, back, and again. And you should feel that stretch. It should feel good right through here. 4 more. 3, 2, and 1. All right. From here, let's take your arms out in front. Palms here are inside, and then you're going to pull, contract the muscles in your back. Big stretch out. Pull, stretch. Keep going, big stretch out. So contract the muscles in the upper back, and then you're stretching out. And open up the chest. That's what's happening as well. You're stretching your chest here. Then your back is stretching. Now, this time I'm going to ask you to hold right here, and then you're going to pull back for 4. Contract the muscles in your back. 1, 2, 3, and then you hold. From here, let's take it out and stretch. So push out in front of you, and you can stay straight up, or if you want to curve a little bit, that's okay too, whatever feels best to you, and get that stretch across your back. And then from here, we're going to take those arms up here, pull back, and your elbows are in line with your shoulders. So we're going to pull back for 4. 1, 2, 3, and hold. So now we're stretching across the front of your body, shoulder to shoulder. All right, and then arms come down. Now let's work on the core a little bit. So your feet are apart, keep those knees bent. We're reaching from one side to the other, and you want to keep your chest open. Sometimes people have a tendency to kind of round the body as they're doing this. So chest is open and just going from one side to the other. You should feel this around the whole core, side, side. All right, now we're going to do it again, and we'll do 4 more, and 4, 3, 2, and this time hold right here. So your hand is here. The opposite arm, you take it over, reach, big stretch. Try not to let your body turn. You're opening up here, reaching. Now we're going to reach a little bit deeper. So don't hurt yourself. This should feel good. So it's reaching, not bouncing. Reach, 2, 3, hold, 4. All right, now you can stay here, or if you want to, you can take both arms out and hold here. All right, now everybody bend your knees and you come up using those core muscles. Pull in tight here and then lift and up. All right, from here, let's take it over to the side, other side here, hold. This hand here, you're reaching down. And then you're going to take the arm out if you want to, hold right here. Reach, reach, reach. All right, and then come on up, 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 and let your arms come down. All right, your feet are apart here, and I'm gonna have you tap your toes. So you're shifting your weight side to side, tap, tap, tap. And from here, you're going to actually bring your heels up. So bring the heels up behind you, keep going, and heels are coming up. And then from here, you're going to bring those heels up. I need you to see my lower body now. And up, and 4, 3, 2, and 1. Bring the feet closer together. So what I just did is I got the front and the backs of your legs stretched out. Now I'm going to ask you to take one foot out in front of you. It looks like this. So you're on your heel. Your arms are down here. We're going to alternate your stretching here. Now, please don't bounce. You're reaching. Reach, reach, reach. Again, 4, 3, 2, and let's hold right here. Let's take both hands down. Now, don't worry if you can't reach for the toes. Even if you're reaching for the lower leg, that's okay. Okay, just hold it, and we never bounce. Please, no bouncing, not this, not this. That's gonna cause the muscles to pull uncontrolled, and so we want to stretch it, and the stretching is easy. Let it stretch out. The muscle will stretch itself out as you hold your position. Okay, come on up. Now let's do the other side. So let's take, you're taking your foot up and hold here. Now let's reach again. Reach, reach, toes are up. 4, 3, 2, and 1. Both hands come down and hold, hold, hold. That should feel good in the lower back, going into your glutes, the hamstrings, and the calf. All right, now carefully come all the way back up. We're going to take your feet apart, and you're going to bend one knee, and the knees and the toes point forward. So you want to keep this knee bent, toes forward, toes are up here, and just hold. Hold. Now, if you'd like, you can go down a little deeper. And so what you'll do is reach down in the center and hold it. Okay, no bouncing, just hold the stretch. Now we've got the inner thigh stretching and the outer hip and thigh as well on that side. Hold right there. All right, come on up, and then to the other side. And this knee is bent, toes are forward, toes are up here, this leg is straight. If you'd like, you can stay right here. If you're comfortable here, that's great. For a deeper stretch, you reach down and hold right here. All right, and then from here, let's keep both feet parallel, bend the knees, and I'm gonna have you come all the way back up, roll up, 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 shoulders, come up last, and then from here, let's work on those arms. So you're turning here, here, and you turn. Now let's take those arms, big stretch like in a V, take it here, here, keep going. Now, from here, we're going back. Easy, easy. If this is uncomfortable, please stop. Nothing should hurt. It should all feel good. And it might be a little uncomfortable sometimes because if you have muscle groups that are tight, so you just hold the stretch and let the muscles stretch themselves out. All right, so let's go back to this position. Palms are up, you tighten those hands and the forearms, and then biceps, triceps are contracting, and big stretch out. So pull, stretch, pull, stretch, and your hands are working those muscles in the hands. So in my work, I actually do stretching with our employees, and we actually do a lot of the stretches to help prevent ergonomic injuries. So this is one for hands, arms. All right, now let's hold right here. Let's take it out front. Let's take your thumbs inside, wrap your fingers around. Now from here, hands are going to go in this position, so your thumbs are inside your hand and you're moving easily. So it's down, up, down, up, down, again, down, easy, not too fast, okay? Because we're trying to stretch the muscles and tendons here going into the arm. Stretching, relax, stretch again. 4 more, 3, 2, and let's hold right here. Hold that stretch. Again, this should feel good. It shouldn't cause no pain in stretching. No pain in stretching. It should feel good. And then open up. All right, from here, I have just a minute or so left. So what I'm going to do is I'm going to do some dynamic movements so that gets your heart rate up a little bit, and then that's going to help with energy for the rest of your afternoon. So from here, we're going to go over, over, across, across, over, over, across, across, over, over, across. Let's do it again, and over, over, across, and hold in center. All right, now from here, you take those arms up, big stretch here. Now you're gonna bend the knees. You don't have to go all the way down, just bend the knees, and your toes and knees should point in the same direction, all right? Might be out, whatever you're comfortable with, or they're parallel. So take it down and up. Okay, again. Now let's hold right here. Now reach, big stretches, nice and tall towards the ceiling. Reach, reach, up. Let's do it again. Keep going, long stretches. 4, 3, 2, and 1. Take it up together at the top. All right, from here, we're gonna breathe. Inhale, exhale, again, inhale, exhale, and one more time, take a deep breath in, inhale, and exhale, and relax. Have a wonderful afternoon. Thank you very much for having me, and everything's been fascinating so far as what we've seen this morning. Take care.
Thank you so much for that stretching session. That was definitely much needed in between this.
I'm glad. Thank you.
You're welcome. So now we're moving on with the agenda. Next, we're going to have a talk about resilience and self-care in the midst of pandemic. And we have 2 dynamic speakers today. So we have Dr. Marquetta Wills and Shelly Henderson. I'll start with Dr. Marquetta Hill. She is a board-certified licensed psychiatrist and a co-founder of the Health MD, an organization whose sole purpose is to optimize the mental health of Americans. And she recently co-authored the groundbreaking book entitled Understanding the Mental Health. She's cared for severely ill patients, and she's currently works as a corporate level physician executive in a Fortune 100 managed company, and she sees patients in student health settings. She earned her medical degree from the University of Pennsylvania School of Medicine, completed her residency in adult psychiatry at Harvard, Massachusetts General Hospital and McLean Hospital program. In her last year, she was the chief resident of that program. She has received numerous accolades and awards throughout her career, highlighting her community achievements. And that's Dr. Marquetta. Next, Dr. Shelley Henderson. After completing a Capitol Hill internship, she was hired by Congressman J.C. Watts, chair of the House Republican Conference, as a staff assistant and public project coordinator. She was next appointed by President George W. Bush to serve as the Director of Outreach at the U.S. Department of Education. She was then recruited by Chief White House Strategist Karl Rove to become Associate Director of the White House Office of Public Liaison. There she worked, her work consisted of coordinating public relations, education, communication efforts across diverse communities and constituencies on behalf of George W. Bush. She was responsible for building coalitions through presidential policy initiatives and strategies. She's a proud graduate of Trinity Law School in Orange County, where she earned her master's in legal studies in human rights and doctor of law. She's a graduate of the prestigious Women's Campaign School at Yale University, as well as Los Angeles African Americans Women's Public Policy Institute at the University of Southern California. So without further ado, I'm going to introduce the both of you to give us this wonderful lecture on self-care and resilience. Welcome.
Thank you, Dr. Ubani. I am excited to talk about this topic of resilience with my dear friend, Dr. Marquetta Wills. And she has a wonderful presentation prepared for us. Before we get started, I'm going to ask Dr. Wills, we've done some stretching and we've gotten our bodies loosened up. And Dr. Wills is going to lead us through an exercise that's going to allow us to loosen up our minds a little bit before we dive into the presentation. Dr. Wills?
Thank you so much, Shelley. This has been just a delightful, delightful session and program, and thank you so much for inviting me here. I'd like to invite, now that folks have had an opportunity to do some stretching, to really think about relaxing your mind. And we are going to have a moment, just one moment of meditation and mindfulness. For those of you who've never done meditation and mindfulness before, it's really simple. It's basically just closing your eyes and taking a couple of deep breaths and breathing in and out through your nose, and really just focusing on your breath through your nose. So your breath really is what I like to call your home base. Your mind is an active, wondrous machine, and it will wander. We all know that. And don't stress yourself out about your mind wandering. When your mind wanders, just gently and non-judgmentally bring your focus back to your breath. So we're going to do one moment of mindfulness and meditation before we get going with the program. Let me set my timer here to get us started. And let's start now. Close your eyes and just focus on your breath.
All right. Wiggle your fingers and toes and come back into the virtual space where we're all collected here. I hope that was a nice, restful moment. Um, Shelley, I'll turn it back over to you.
Sounds good, wonderful. I've stretched my body and now we've settled our minds a little bit. Thank you for that. So in this presentation, we're going to talk about resilience through self-care. I could not think of a better presentation to have preceded this presentation. Dr. Batiste did an exemplary job talking about stress and those kinds of things. We'll go over some of that. But what is resilience? Resilience is the ability to adapt well in the face of adversity, trauma, tragedy, challenge, or like we learned in the last presentation, or stress. It is that ability to bounce back from negative experiences or difficult challenges. I want you to think about a rubber ball. You can kick that ball, throw it across the field, bounce it repeatedly, but ultimately, that ball will come back to its original state. That is resilience. Resilience is what allows us to face challenges and problems, overcome them, and then get back to life a little stronger and a little bit wiser. Um, Resilience allows us to cope and manage our emotions through adversity in ways that protect us from becoming overwhelmed. And what you're going to see in this presentation, resilience actually can help to move us forward. And so with that, if we could move to the next one, the next slide. I want to again just introduce Dr. Marquita Wills. I'm so happy to do this. I've known her for many, many years. And so it's a pleasure to present this and have her present this to you. If we could move to the next one. All right, so Dr. Batiste talked about stress quite a bit. Let's move to the next one. All right, so everyone agrees that the logistics, particularly of this pandemic, but even prior, pre-pandemic, and after this global pandemic is over, stress, as we learned, is a problem. But in particular, this pandemic has shown us and really shown us that there is tremendous stress on families now, on relationships, really just exasperated some of what was already there. And so, Dr. Wills, could you just talk a little bit about stress and tell us what happens in our bodies when we go through significant stress?
Yes, I'm so excited to be following Dr. Batiste, who gave a magnificent word on stress. So, as we know, stress causes a release of certain hormones, and those hormones are cortisol as well as epinephrine. And it's that fight or flight sensation that is released when we're stressed. And stress happens for lots of reasons. Common sources of stress are listed there on the slide. It could be work, money, school, health, relationships, or political climate. And it can manifest itself in both physical ways as well as psychological ways. So physically, you may have tight muscles, aches and pains, inability to sleep, upset stomach, fatigue, just feeling groggy and foggy, or headache. All those are physical manifestations of stress. And then you can have psychological manifestations of stress. So tearfulness, poor concentration, unable to focus, irritability, snapping on people, being nervous or anxious, and then just feeling overwhelmed, like you just don't know where to start. As Shelley pointed out, this has been a particularly stressful year for all of us.
78% of Americans report significant stress due to the pandemic. 70% of Americans reported significant stress due to the election. And that was folks on both sides of the aisle, because the issues were just so close to home for everyone. And so our nation has had a particularly stressful year. And I'm looking forward to sharing with you a framework for thinking about how to invest in yourself in order to build up your resilience capacity.
Awesome. If we could move to the next one. And the next one, we talked a little bit about how stressful things have been. So you have, Dr. Wills, you have a very specific framework and approach for building that resilience. You approach it through self-care. Now, I said in our introduction, I talked about bouncing back, but I know you have something to share with everyone that's a little bit different. Talk to us about that.
That's right. That's right, Shelley. You know, in times of stress, if we are intentional, proactive, and aggressive about managing our self-care, and we'll get into what self-care really looks like, we can use that as an opportunity to not only just bounce back to where we were from the adversity, from the challenge, from the stress, but use it as an opportunity to really bounce forward into the next frontier. And so taking that as a way to move ahead and even find ways to accelerate through periods of stress. But again, it requires sort of a relentless focus on oneself. I like Dr. Batista's acronym of selfish, being selfish. We'll go over in a slightly different framework a lot of those principles again on how to invest in oneself in order that one prepares oneself for the future, where you can move forward, dig deep, and uncover all of the gold that's inside of you waiting to manifest. Because it's my belief that happens most often once we do go through stress, once we are tested, once we do find out. It's that ability to kind of bounce back and bounce forward that allows us to become our most full selves.
Yes, if we can move to the next one. All right, bouncing forward. And the next one. Okay. And so that's powerful because I think, need to be taught sometimes to prioritize ourselves. Like Dr. Batiste said, you know, selfish can have a negative connotation. But the fact is, like you said, we must prioritize ourselves. We absolutely have to be selfish. So with that, what exactly is self-care? We hear this term all the time. Dr. Wills, what is self-care?
Thank you, Shelley. I appreciate that. Self-care is really about finding ways to recharge your own personal battery, figuring out what works for you. And people oftentimes say, I just don't have the time to do it. I don't have the time to do it. And I maintain that you almost don't have the time not to, because life is short. And it's important to capitalize off of every moment. And so it's kind of paradoxical, but it's the notion and the idea of slowing down to speed up. And that'll be a recurring theme as we kind of step through together some pieces that really are important for a good self-care game, which is really important as we build resilience to get through these periods of stress.
Right. If we could go to the next one, please. And so you have a framework that's on the screen. Let's dig into the three of them, and then we have a special one we're going to talk about as well. But prioritizing number one, our physical health. Um, Again, it's been a recurring theme throughout this wonderful conference we're having here. But just talk to us about taking care of our physical bodies, particularly during this pandemic. I know in my subdivision, the gyms are closed, the gym is closed, but we still need to take care of ourselves. Talk about it a little bit.
That's right. That's right. I love Dr. Batiste's video on cooking healthy foods, but always having that bottle of water nearby, giving up the sugary drinks, and selecting nutritious foods is the cornerstone of any good self-care program. Another thing, we talked about those hormones that shoot up, cortisol, epinephrine that shoot up. One thing to combat that is to exercise 3 to 5 days a week, whether that be light stretching, like we all just enjoyed, or whether that be more vigorous exercise, whatever's clinically indicated for you. But making sure from 30 to 60 minutes in that 3 to 5 times a week, getting that exercise, and that releases what we call endorphins. I call that our happy juice in our brains, and that directly goes against the cortisol that we talked about. Obtain fresh air and sunlight daily. Vitamin D and sunlight allows us to process our vitamins the way that we need to. And then others have talked about how important sleep is. I feel like in our society, we almost glorify sleeping for 4 or 5 hours a night. And I love to hear LeBron James talk about how important sleep is to him being at the top of his game in terms of focusing and functioning. And so making sure that we do not have the news on at night before we go to sleep, making sure that we're not looking at our phones, our tablets, TV. That blue light interferes with our melatonin hormone, which regulates our sleep-wake cycle. 8 to 9 hours of sleep, I'd say 7 to 9 hours of sleep is optimal for most adults. I hear a lot of people saying they're only getting 4 or 5 hours of sleep every night. Burning the candle at both ends is not advised. So sleep is something that should be prioritized, and really figure it out, how to weave that into your schedule in an effective way. And again, you take that time for yourself to prioritize yourself in that way, you're more creative, you're more productive, you're more focused. You're more open and collaborative. And so taking care of yourself physically works really well with your emotional health as well, to build that resilience capacity.
Yes, I know. I found it very empowering, actually, when I move into the back part of the house, where my bedroom and those places are. I leave my phone purposely in the front part of the house, because if I don't, I know that I'll be interrupted all night, and I won't get the adequate amount of sleep. And I'm sure there's lots of folks out there just like me. So thank you. Let's move to the next one, please. And we're going to talk about emotional health. Emotional health. Talk to us about this. I know this is particularly an issue again now during this pandemic time.
That's right. That's right. And if there's anything that I feel like, as a mental health practitioner and champion that we don't talk enough about in our society, to ourselves, to each other, to our children, it really is about our emotional health. And if there's one thing about the pandemic that I'd have to say, I feel like mental health is becoming more and more top of mind for people. And people are realizing exactly how important it is, and making room and making space for these types of discussions. So I'm really elated about that sort of silver lining of the pandemic. One of the things that I think is so critically important to optimizing your emotional health is, from time to time, to just think about it. I think we are so used to, as Americans and as a society,
just marching through, getting it done, not having feelings, stuffing it down, etc. But it doesn't really work. It's always going to come out somehow, some way, your emotions. If you don't acknowledge them, understand how you're feeling, and just sit with them and say, you know what, I'm going through a stressful period right now. This is stressful. You don't have to be Superwoman. You don't have to be Superman. And the other thing is, you don't have to tell anybody. It's not like I'm saying, run around telling everybody how stressed out you are. I'm just inviting you to take that time once a week to check in with yourself, and that's something that we're not often taught. We're often taught just go and make it happen, and don't worry about it. But this is so important because if you don't do it, whatever negative feelings you have up, whether it's stressors that are going on in the household with kids, challenges with parenting, whether it's challenges at work, whether it's election stress, some of the things that we identified on that first page when we first got started, just acknowledging how you feel is really helpful, because otherwise you're going to not be able to sleep. You're going to be running for bad food in the refrigerator. You're going to be irritable. You're going to be not as productive. So just the awareness of how you're feeling is such a huge step to optimizing your own emotional health. Then there are other things, like always being super positive and super optimistic, even in the face of adversity. Try to always look for those silver linings. And the fact of the matter is, over time, they usually always emerge. Life is nuanced. Most things aren't either all bad or all good. So even if it feels like, oh my gosh, somebody's doing this to me, reframe that and think, why is this happening for me? Because if we all believe in sort of a divine order of things, and that God has purposed us and ordained our lives, then there's always going to be good that can be found from every situation if we take that time to just shift our frame of reference. Another thing that happens is, so often we just get caught up in the rut of life. We've got kids to drop off, we've got work to do, we've got deadlines, we've got church and sorority obligations, we've got this, we've got that. And before we know it, our calendar is running our lives instead of us running our calendars, right? So that's something that I think that we all need to do too, is take that time to stop from time to time. Once a month, I advise most people to set goals, but set aside time to really dream and strategize so that you're in charge of your life. You're holding the paintbrush and you're creating the life that you want for yourself, so that ultimately you can thrive and soar. Establish a daily mindfulness practice. I think this is so critical. I see patients both for folks who are struggling with psychiatric and mental health challenges, but I also am a life coach and see folks who are doing fine, and we're just trying to figure out how to optimize their life so that they can soar. And one of the key things that helps unlock and unleash potential for everyone and build that resilience capacity is exactly what we did at the beginning of this session, which is taking that time for mindfulness and meditation. Dr. Batiste talked about how important it is as well. I meditate for about 30 minutes a day. And I've been doing that probably for about 3 years. And it really just shifts and transforms your life. If you take literally just 10 minutes a day, that's all it takes to do what we just did earlier, which is just sit there, clear your mind, and notice your breath. Your mind will veer off, and you just gently and non-judgmentally bring it back. There are lots of apps out there to support that. I like Calm, I like Headspace. I advise those for all my patients and clients. Finding ways to connect with nature. The universe is such a beautiful thing, and we're all connected, a part of it. So fishing, hiking, boating, trails. I know people love gardening, being plant moms, seeing things grow. It's just so much a part of opening up your mind and optimizing your emotional health. Keeping a gratitude journal. So keeping track of the 5 things for the day that you're most grateful for. Those could be things that we often take for granted, right? Like the ease of internet, or the ease of accessing electricity, or they could be more specific and less general, but taking the time to really take stock of that every day helps bring you to a different place, so that you can be your best self and bounce back even during these periods of stress. And then again, aligning only with your purpose. Once you identify what your purpose is, being able to not get whipped around by this and that, being confident in who you are enough to say, no, that's not going to work for me right now, and setting good boundaries about that. So those are some of the things that we need to be talking to our kids about, in order to help them be aware of even how to take care of themselves emotionally, to prevent things from happening down the line. So that's the emotional health pillar.
Got it. Now let's move on to the third one. If we could go to the next, and that is prong number 3, social health. Social health. And I was thinking about this earlier. We are a culture that has created Facebook, that has LinkedIn and all these platforms to be more connected. Yet the data shows us, Dr. Wills, that we are actually more isolated than ever before. And this is pre-COVID. So connection is very important. Social health. Talk to us about that.
Yes, we are certainly human beings, and our social connections almost act as just little mini reflections of who we are. And it's like mirrors of different aspects of ourselves as we learn about ourselves and grow in each interaction that we have. So, one of the things one of my mantras is just assuming that everybody's doing the best that they can, right? Most people, even if they've got a personality that's a little tricky to deal with, for whatever reason, that's the best that they can show. That's the best way they can show up. So just assume every time, even if someone irritates you, pushes a button, that they're doing the best that they can, and keep it pushing. And that perspective allows you to then move into number 2, which is use each interaction in a deliberate, intentional way to be both teacher and student, and find opportunities for growth in every path you cross. Find solutions in all interactions. Be on the lookout for them. Be intentional for them. So that's really important. And then just normal things, say thank you, show appreciation, identify traits you're grateful for in others. Again, even those who have tricky personalities, maybe you can kind of flip that around, find the silver lining. They're perseverant, they're determined, there's something, they're trying, even if they do tend to activate others around them. Find coping strategies to manage those people who have more challenging personalities. So if your sister is kind of hard to deal with, make sure you say, hey, I got 1 or 2, 3 skills, right? I'm going to rise above. I'm going to take a deep breath before I go in there with her. And when she asks me to do something, I'm going to politely say no. So you've got coping strategies. You've already developed a plan so that you don't get triggered. And then invest in relationships with those who tend to energize you and bring your energy level up. Helping is always a great way to bring out hormones of bonding that counteract that stress. And then loving on your loved ones. We talked about love. Dr. Batiste talked about love earlier. Those are oxytocin and other neurotransmitters that combat stress and that make you more resilient. And we find, as Dr. Batiste talked about, that people who are socially isolated are at much higher risk of having physical health conditions. So all these things all tie back in together.
your physical health, your emotional health, your social health, and being super intentional about it is what allows us to be our best selves and to bounce forward through adversity.
Absolutely. We have just a couple minutes and then we want to entertain questions. So let me hasten and just say, the individual who is listening to this, Dr. Wills, who feels a little lonely, who feels super isolated in the midst of this pandemic, and they were already perhaps short on relationships that go beyond the shallow realm, and now they don't have perhaps the opportunity to make them. What would you just quickly tell us? What would be your advice to that individual?
You know, honestly, putting these things in place really helps. So meditating and exercising alone, those two things alone would really help. But I've been encouraging a lot of people to volunteer at the SPCA, either as a foster parent for pets. Pet therapy is so critical and important for people who are socially isolated as well. And then finding ways to stay connected online and safe distancing, are other things. I know some elderly people who have really commented that meal times have been the most challenging, where they haven't had an opportunity to eat with others. You know, that ritual is such an important part of the social connection and social fabric of our society. And so doing things like what we're doing now, the televideo and video conferencing, particularly during mealtime, can help bring some of those new ways. And we're gonna have to do it for a little while longer. We got 6 to 8 months, you know, making sure that people are having special holidays, doing drive-bys for the holidays for people who are at home alone. It's really incumbent upon all of us to take care of our society's most vulnerable at this time.
Thank you. And just real briefly, before we open it up for questions, there is a fourth prong that was not on the screen. And because I've known you for a very long time, I know that this is absolutely a part of the foundation and core of who you are. And that fourth prong is spiritual health. And spiritual connection. And we know and we understand that it is not at odds with things like meditation and mindfulness. But could you just quickly talk to us about that fourth prong of self-care and building resilience of spiritual health?
Very, very happy to, of course, as a woman of faith, and I know you are as well, Pastor Shelley, that you know, our bringing our spiritual lives and leaning on our faith during times of adversity just is so important in building our resilient reserve, whether that be reading as spiritual text, you know, the Bible, the Quran, the Torah, and praying in fellowship with others, praying alone, making sure that you are showing gratitude and living a exemplary life that's value-based is important. It's important. And so all of that works together, making sure that you're optimizing your spiritual health is an important part of things as well.
Awesome. Well, I would just, if we could move to the next slide, and you can just talk for a moment, and then I know you have a very special announcement.
Yes, I do. And then I also see an excellent question in the chat that I want to address as well before we move on. So, you know, yes, about 60%, 70% of the American population doing this kind of self-care is going to be enough in terms of getting them through whatever challenges or adversities they're going through. But there's then going to be 20 to 30% of our society who may need to reach out for more specialized help. And so that cut point is a very subjective one, but it's an important one. And I'm glad the question was asked. You may need to reach out for professional help with a therapist, a psychiatrist, someone like me who can prescribe medications. And you do that if you realize that your level of functioning is impaired. And what I mean by that is if you're not able to function as a parent, as a student, as an employee, as a partner, if areas of your life are getting impaired for longer than 2 to 3 weeks, and it's not something that's going away, but it's worsening, you may think about seeking out professional help. The best places to go in that case would be your primary care physician, a pastor at a church. If you're employed, your EAP, Employee Assistance Program, is also a wonderful place to open the door if you're having emotional issues that aren't going away by just taking good care of yourself. And so I'm really glad that question was asked because it's an important one. There are times when you can do all the self-care you want in your world, but you need therapy or you need to be on medications. And so I want to leave open time and space for that as well, for people who are having psychiatric difficulties and are having a diagnosis. And we want to make room for that too. And that's one of the things that we talked about in our book is really how do you know when someone is just sad or if they're clinically depressed? How do you know if someone is just anxious for a short period or they have a generalized anxiety disorder? And you really need to be a mental health professional to ascertain that. But our book, which is written at about a 5th or 6th grade level, so for patients, their families, it covers all psychiatric conditions, including schizophrenia, bipolar, all of that, because there's so many questions about that. So it can be found on Amazon.com or BarnesandNoble.com. And then check out our website, Healthy Mind MDs. Our dual mission for Healthy Mind MDs is number 1, to optimize the emotional health of everyone, and number 2, to really destigmatize mental illness and making room for those who do have mental health issues to get the care that they deserve in a safe, stigma-free way. We also have a blog on Psychology Today where we talk about some of these things in depth. We're also, our most upcoming blog is going to be about how to really survive the holidays with Corona, with everybody being, it's such a different format. So really excited about some of the opportunities that we're having to promote our brand and our book. And thank you, Shelley, for this opportunity.
Dr. Wills, there is, as you well know, there's a stigma in our community sometimes about seeking professional help. You know, what can we do? We talked about disparities earlier this morning. What is it that we can do to help dispel the stigma about reaching out to a mental health professional like yourself?
Well, thank you for asking that. That's something that I am trying to do in every aspect of my life, which is destigmatize mental health and seeking professional help. I think one of the things is just talking about it, just like we're doing right now, talking about stress, talking about emotional health. And we're at a time when it's impacting everyone, and everyone is a lot more attuned to how important mental health is because of how rapidly our lives changed and how much stress and trauma we were all under. And then also everything that was going on with the election and the rhetoric on both sides and the racial injustice and all of that. So I think we all got really, really sensitized to how important our emotional health was.
Absolutely. I'm looking in the chat. I don't see any questions. While we're waiting perhaps for the next question, as someone who has known you for a very long time, I'm so excited about something very significant that has happened in your life recently, I think it is appropriate to announce it here amongst friends of the Association of Black Cardiologists. What is your exciting news for us?
Yes, I'm so excited to announce that I was recently named Chief Medical Officer at Johns Hopkins Healthcare in Baltimore, Maryland, which is the managed care arm of the Johns Hopkins Health System. So I'm super excited about my role in optimizing health outcomes for folks in the Maryland area and beyond in terms of quality metrics, and then from a cost-effective perspective. So really excited about that leadership role and that recent announcement and my upcoming move to Baltimore.
Yes. Let's see. Congratulations. I'm just checking.
Thank you.
If you have any questions in the chat?
Lots of congratulations. Thank you so much. I appreciate the love from ABC. Thank you.
Absolutely, absolutely. I don't see any questions at this time. Dr. Wills, we've talked about resilience and really prioritizing oneself, self-care as a way to become more resilient, to really increase our capacity to go through seasons of challenge like we all are. But have the ability to not just bounce back and be at the same, but really to bounce forward and move our lives forward by prioritizing ourselves. Do you have any last words for us as we come to a close?
Yeah, I just do it. Just do it. There are so many reasons why people come up with excuses to not do it. I'll do it just like Dr. Batiste was saying. I'll do it tomorrow. I'll start tomorrow. I'll wait till after the holidays. I'll wait till the first of the year. It's too expensive. I can't this, I can't that. We can't afford not to prioritize ourselves. The stakes right now are entirely too high to not be our best selves. And so just take the tools that this organization is providing, get in there and figure out how to get your diet right, your exercise right, your sleep right, your meditation game right, your prayer game right. I mean, it's just so important at this time in order to be your best selves and give the world what you have to give.
Thank you so much, Dr. Wills. It has been a pleasure being in this session with you. I know that all of our listeners gained a lot, and I appreciate being on here with you. Thank you, everyone.
Thank you, Shelley. Bye-bye, everyone.
That was incredible. Thank you both, Drs. Wills and Henderson. I'm gonna tell you, there's moments in time when things were meant to be. The way in which this program was put together, from Dr. Ubani's presentation to my presentation to this presentation, without any of us knowing what the other was presenting in detail, this was meant to be. And I believe that there's someone out there who's listening right now, who's being reached, who's being touched and looking for resources. And I think the theme is consistent in terms of what you need to do to change the tide of what's going on in your lives and in the lives of those around you. So it's such an honor, ladies, to have heard you and to hear the similar type of passion in what you're doing that's synergistic with what I'm trying to develop and to do too as well. So it is indeed an honor, and we enjoyed your lecture for sure.
Thank you.
All right, so we're gonna turn so we're not done yet. We're not done yet. We still have great information in store for you. And so right now, what's been on all of our minds is COVID-19 and really cardiovascular disease and what you need to know about access to education and your health. And so it's my distinct pleasure to welcome a very honored panel that includes Becky Gomez, trustee from Orange County Board of Directors, there in Tustin City Council, Dr. Lavona Lewis, who's at the University of Southern California and School of Public Policy, Dr. Marcia Lowe, who's the second vice president, National Black Nurses Association, and Dr. Wycliffe Wright, who is an infectious disease immunologist out of Nashville, infectious disease specialist. So want to definitely welcome them in for this panel discussion and look forward to a robust discussion. Definitely want everyone out there, whether you're listening on Facebook Live, if you're listening on the Zoom link directly, to tap in. This is your opportunity to tap into specialists about the issues surrounding the coronavirus. Type in your questions, and we definitely want to try and get to it and have a robust conversation. So welcome to the panelists. What we will do as they look to join us is I'd like to have them each go around and just in about 20 seconds or so, 20 to 30 seconds, just give us a little background of who you are and things that you want to say additionally.
So I'll start. I'm Lavana Lewis, as you've heard, and I'm on the faculty at the USC Saul Prairie School of Public Policy. I'm also the Associate Dean for Diversity, Equity, and Inclusion, and do community-based research, particularly around cardiovascular disease and diabetes and issues of food security and physical activity. So good to be here.
Welcome, welcome. Ms. Gomez, I'll let you go next.
Well, thank you for having me. I'm currently a trustee for the Orange County School Board. I was elected in 2016 and elected again in March of 2020. I'm currently a delegate to the county and the state school board associations. I'm also a former city council member and mayor pro tem for the city of Tustin, and I'm awaiting the results of the recent election to determine if I will return to the city council. For my real job, I'm the Dean of Health Science at Cypress College, and I oversee 8 health science programs, including one of the 15 baccalaureate programs in the state of California for funeral services. I'm a longtime community volunteer and spent 25 years in the healthcare industry before going into the academic setting as a full-time professor, program director, and finally the dean. So thank you.
Thank you, thank you. Dr. Lowe. Dr. Marcia. All right, we'll move on to Dr. Wright.
Thank you for having me on your program today. I'm Wycliffe Wright. I'm an internist and infectious disease physician in Nashville, Tennessee. I'm engaged in both private practice, seeing patients in internal medicine and in infectious disease in my office and in a hospital setting. And I also consult to some hospital corporations, helping them to better understand Medicare or the payer rules and government rules around documentation, physician documentation, and payment for the care delivered to patients.
Wonderful. Well, welcome to all of our esteemed guests here. We're going to go ahead and start off with one of the questions that was submitted that we have for you. The first question states, you know, we've seen the sad news. We've seen, I mentioned it too as well, the rising rates of COVID-19. We've seen the disproportionate impact inside Black and Brown communities, many other minority communities too as well, Native indigenous populations as well. What advice do you have for people attending today's session in order to take care of themselves and their families? What advice do you have?
I'll start with that question, if that's okay.
Yes.
So this COVID-19 disease is caused by a virus, like many other infections. And the advice I would have for anyone is the best place to get information regarding this disease would be your usual medical provider. If you have a physician and you want to get information, there's so much that one can find on the internet and elsewhere. But if one wants to get accurate information, they should first talk to their regular healthcare provider and then seek additional guidance from there. So that's the first thing I would say. Then the second thing I would say is that I've treated patients in the past for bacterial and viral infections. One of the viral infections would be influenza, regular flu. Things like herpes simplex virus or shingles. I've also treated people for things like tuberculosis and meningococcal meningitis. And in those situations where families in the hospital come to visit their relatives, and I would say because of this disease, it's important for you to wear a mask to protect yourself from getting that infection. Almost all those family members would unanimously and willingly agree to wear a mask. So this disease, COVID-19, caused by this virus, can be transmitted through the air, and wearing a mask is protective. I'm still at a loss as to why during this time, that good advice people used to follow, they are reluctant to follow today. So I would say it's important that people wear a mask. And the final thing I'd say is the families probably should get together and talk about how illness of one member will affect others. When I managed patients who had HIV in the 1990s, the elders, the parents were having a hard time grappling with the loss of their young child or teenager, someone who had gotten HIV, or a young person who was in their 20s. Now it's the reverse. Young children or youngsters are having a hard time grappling with the loss of their adults, even though that's more expected. We'd expect our parents to die before we do, but that's premature. So it's still a challenge, and these are some of the things people should be talking about. And probably people should all be making wills, making a will as to what they would like to have happen should they become sick, because this can happen unexpectedly. So not only should the parents be making wills, but the children should be making wills as well.
Wow, thank you. Those are three great points, three great points. I want to open it up to our other doctors, Drs. Lewis or Gomez. Any comments or thoughts about that first question regarding advice for people during today's COVID environment?
Well, I think that probably for most people, if they don't have a primary care physician, they're going to be challenged a little bit. So again, there's lots of resources right now out in the local public health departments just to help people start to educate themselves. There's one organization here close by Tustin in Santa Ana called the Latino Health Access. And that's been a great organization to try to deliver more culturally appropriate health services and programming. And their goal is really to reduce the burden of chronic disease and strengthening family, mental and emotional health. And especially when there's multi-generational families, we have to try to find the sweet spot in educating someone in the family to try to be the champion for the family. So a lot of times there's some smaller organizations that can be sought out and to be a resource for folks. So that would be something that I would recommend, as well as what Dr. Wright mentioned as well. Masks shouldn't be political. They should be, it's a public health issue. We need to do it.
Thank you. Wonderful, wonderful. Dr.
So
Lewis.
just a couple of points, and I would agree with everything that I've heard so far. The only thing that I would add would be to pick up on this issue of the conversation and having someone that's a champion for information. I mean, I think it's important that every family has someone that's willing to be unpopular and be honest with folks about what's really going on and be unapologetic about saying, I love you enough to want you to survive. And so I'm not going to apologize for speaking science in this situation and doing what I can to make sure that this family lives, because it seems like everything's politicized right now, but we shouldn't have to apologize for wanting the people that we care about to be healthy and to survive. And again, sometimes we just have to have those tough conversations that, again, may sound dark, but the reality is lives are on the line and we have to be honest about that.
Wonderful, wonderful pearls, wonderful pearls.
There's another thing I wanted to say about that as well, and that relates to this being a novel or new infection. And there's this temptation to say that if young people get this infection, they will recover and do well. That's overlooking the experience with measles or polio. People who had polio and measles when those outbreaks were first occurring developed the acute symptoms. But at that time, there was no clarity as to how they would do later on. And 10 years later, people were dying from complications of polio or measles. Mm-hmm. So we're still unsure about the acute effects of COVID right now, but we are totally in the dark as it relates to what may happen in 6 months or a year or 10 years. So for people to unnecessarily expose themselves and say, well, I'm going to get immune, when we don't know how long that immunity lasts. And the factors I just outlined is not wise from a medical perspective.
That is such important information. And there's data that really kind of show the impact of the COVID virus on the cardiac system, on the ventricular function and infiltration. And so it brings to light really the issue of cardiovascular disease, which even to the youth, many times don't understand the fact that coronary disease begins in the childhood, in the youth, and it progresses and still can lend itself. And so we see this deadly occurrence in this relationship between coronary disease, COVID, especially in these minority or overrepresented communities, at a higher disease and higher death rate. So the question is, how do you believe our audience should think about the fears of going to the doctor? I mean, you brought up the importance of establishing good relationship with the doctor and having a point person and resources in the community, but there's a great deal of fear. We're finding that people are not seeking out medical care and they're presenting late or after the effects. So how should they go about this, given the concerns regarding the COVID pandemic?
Well, I'll just state some of the things I do, doctor. I still see patients in my office during this pandemic. One is I make sure I'm protected. So I wear mask, I wear eye coverings, I wear face shield, gloves and gowns as appropriate. I practice social distances as much as reasonable. Patients who come to my office no longer just come in and wait in the waiting room. They wait in their car, and when it's their time to come in, they come in and I interview the patient very briefly. The main reason they're coming in is so I can do the physical examination. And then I'll call them after they leave the office and finish the interview regarding their medical concerns. So that way I'm minimizing my exposure and their exposure. In addition, some physicians are doing telemedicine where patients can stay at home, use the phone or the computer. I'm not very comfortable with that, so I've not done much of that. But yes, if patients want to go in to see their doctor, if they practice these basic advice that is available, wear masks, wash your hands, socially distance, then we can minimize the risk of exposure.
Very good. Dr. Lewis?
No, I would just kind of piggyback on that issue of risk. If I've got poorly managed hypertension or diabetes, is it riskier not to go with my follow-up care than it is to go into these environments where, in medical environments where they're practicing literally best practice as it relates to, again, what is considered medically necessary in the kind of the public health space. But I do understand, and it really is, it's a personal decision in terms of what that risk acceptance level is. But as someone that has diabetes, if my diabetes was out of control, I would be wanting more of my physician's time than less of it, because again, I'm trying to survive, and I recognize that I'm in a high risk category because of my age and my chronic condition. But I'm going to do what is considered medically necessary so that I can have the best chance of recovery. And I think it's important, again, to recognize that that's an individual choice. We can't force people to want to, stay on the narrow path or whatever. And so I think we just have to let people know what their choices are and what we think the consequences of those choices are, because if we're talking about something being patient-centered, then that's what we have to accept, that people have the right to choose, but we should also be following them so that, again, they don't get lost in the shuffle.
Absolutely. Dr. Gomez?
Again, I would just say our biggest challenge is to educate people. Again, coming from an educator, we really don't want patients to wait till their symptoms are too severe before they seek help. Again, just to point out what Dr. Lewis just said. And one of the major things we need to do is teach people how to advocate for their family members or their friends. And yeah, I know that's easier said than done. And I often tell my friends not to let their parents or spouses go to the doctor by themselves, especially when there's not so good news, but it's a challenge in this environment. It's also okay I tell people to confirm their appointments and ask about the protocol in the office before the patient arrives, so there's no surprises and don't escalate the nerves. because people are already nervous about going to the doctor. We don't need any surprises. Because most healthcare providers, just as Dr. Wright said, when he sees patients, there are specific protocols. Like he said, they were waiting in their cars until it was time for their appointment. They're not waiting in the waiting room. And we want to make sure people keep their regular checkups. And again, to Dr. Lewis's point, if things are out of control, then we've got other situations that we have to do. And I know some providers are doing interviews remotely before the patients come in. And Dr. Wright talked about what his thoughts were. But many providers are offering telehealth services to assist with that initial screening of patients, again, to minimize the time in the office. So I would just really encourage people to check with their provider before they go in.
Those are great words. And there's some follow-up questions for that, but it's my pleasure to introduce into the conversation. I mean, the beauty of COVID is that we've been able to reach a greater number of individuals through technology and virtual platforms, but sometimes technology cannot be our friend. We run into technical challenges. So Dr. Lowe, we welcome you to the conversation here.
Thank you so much. And I can't believe it waited all this time. Then the computer decides it was tired. Not me, just the computer. Yeah.
All right. Now we want to make sure you're not tired, just the computer.
I'm not tired. I'm honored to be here. Thank you so much.
Wonderful. Good to have you. We're going to just let you dive right into the meat of the conversation. We were just kind of just discussing really this last question, which was in terms of going to see doctors. There was one follow-up question I want to touch on before we transition to an important issue of vaccines, and I'll introduce that momentarily. And there was a question regarding individuals going out and seeing their doctors, and someone brought up the question in our panel, inside the conversation about age. Does that also include different age groups? So are 80, 70, 80, 90-year-olds, do we hold the same recommendation for them as we do for those in their 40s, 50s, and 60s? Thoughts on that from anyone in the panel?
I could speak to that, Dr. Batista. I was taking care of my mom who just recently passed away. And when they get to be a certain age, you really just have to select what doctor appointments are most vital to getting them there, because it becomes a challenge anyway because of their age to get them to the doctor. But when they become immobile and those types of things, you have to just kind of, what's the priority to getting them to the doctor? But I tell you, I was blessed to have a group of people who came to the house. I did not know they did that anymore. And they came, the doctor came, and then nurse practitioners came. And that was just really good for us. So if people have resources such as those, and they're in a certain age group, that would be my kind of recommendation, as opposed to getting out if they're a certain age, over 70, say.
It's great advice. Great advice.
Yeah,
Anyone else want?
We can nuance that a little more as well and say, so I offered to visit some patients, but they didn't want to have the doctor visiting their home. So we had that kind of challenge. But then I said, okay, what we'll do is we'll make you the very first patient of the day. So they came in before anybody else would come in. The office would just be open from overnight. Their chances of exposure would be significantly diminished. So there are a lot of nuances and tweaks that doctors will make because they care about their patients and want the best for them.
I love that. I love that. One of the things I want to transition in is a huge issue inside the Black and Brown communities is a degree or a level of mistrust as it relates to vaccinations. And so we've recently heard news that Pfizer has now gotten exceptionally close to having a vaccine for COVID-19. We know about thoughts about the annual influenza vaccination and some of the lower rates. And these are tied to many of the historical issues surrounding it, mistrust from prior clinical trials and things of that nature. So what are your thoughts? And we'll start first with you, Dr. Wright, as it pertains to the COVID-19 clinical trials and specifically the vaccine.
Right. So I've worked with health departments here in Nashville. And what I've learned over the years is that it's a lot more stringent when people want to do trials like Pfizer is doing to ensure the safety of trial participants. So you have government regulators, you may have state regulators, like the case of New York, they're going to be looking over the FDA's back. And all these regulators are looking to make sure that all the protocols in that trial are proper and will protect the participants. That does not remove the risk, the unknown risk of the medication or the vaccine itself during the trial, because that's part of why we're doing the trial, to find out if it's effective and to find out if there are side effects. So yes, it's important that people understand that, as opposed to years ago when these stringent protocols were not in place. Now we have those, and it's a lot more safe for people to engage in trials. So as it relates to minorities, understanding these protocols that are now in place, we need to be less concerned or worried about being misused in trials. And we have to understand that participating in these trials is essential to determine if these vaccines or medicines that people are developing will actually work in our population. And the only way that can be known is if we engage in those trials. So I think we can now be less concerned about malfeasance and more reassured that when these trials actually take place, the medications will be effective for us.
Before I transition to the other doctors on the show, should we take the vaccine when it comes out or not?
And so I think protocols are being put in place to ensure that the way these vaccines are evaluated are not short-circuited. And if those protocols are actually satisfied, then I think the vaccines will be safe once the data is appropriately reviewed. So yes, we should be taking the vaccine.
All right, thank you. Others, let's go around the horn there. We'll start first, Dr. Lewis. Oh no, well, go ahead, Dr. Love.
Oh, I was just going to agree with Dr. Wright, and absolutely, as soon as it comes out, I'm going to take it, because I'd rather take it and have some kind of protection than to be fearful most of the time regarding the coronavirus. We just had a mandate where I work that everyone has to have a flu vaccine, and that has not been the case over the past years, but this year is mandatory. So yes, I think you should take the coronavirus vaccine.
So I am not an anti-vaxxer. I take my flu shot regularly. I take my pneumonia shot, my other shots, but I will admit that I'm more of a skeptic, because I think that it's like the conversation about masks. I don't understand how a vaccine could be politicized, but it has been. And I agree with Dr. Wright that we have to find out whether or not it's effective on people of color. I agree with that wholeheartedly, but my hesitation comes in the fact that it's been done under the leadership of someone who has seemed hostile to people of color and all about capitalism and making money. And so for me to be excited about a vaccine that's going to make somebody a lot of money that hasn't been fully vested or vetted in my community, I'll admit I'm a skeptic. And so I will hold back and see what happens. But I know that if it's proven effective, I will eventually take it, but I'm not going to be at the front of the line.
So I'll say this: the medical community was burned in the past when political pressure was brought to bear on a vaccine being implemented. And I think that was like in 1968 or sometimes around there. And then people started having complications from the vaccine and it had to be withdrawn prematurely. I think the medical community understands their responsibility, and reasonable political leadership also understands why states may have to say, we have to step in and look over the FDA's back and make sure that all the essential steps have been adhered to before these vaccines are released for use in the public domain. So understanding those elements, I think it's reasonably safe to expect that there will be no short-circuiting of the proper approval process. And when a vaccine comes out, it should be safe for use.
That's great. Dr. Gomez, any comments on?
Yeah, just briefly. Unfortunately, I think the vaccines have been used as a political football, and that just has created some mistrust But I don't think that this mistrust is just related to clinical trials and vaccines. There seems to be some mistrust of doctors, just especially for older patients. And, you know, I'll just use my mom as an example. When my mom was alive, she really didn't like male doctors because she didn't feel that they listened to them. So I think it's really important to get more women, and trying to find a female doctor of color was sometimes difficult. But I grew up going to the community health clinic to get my vaccinations on a regular basis. I never really thought about it. We didn't go to our regular doctor. We went to the community health clinic. So I never experienced that same sort of mistrust. And my mom didn't have a formal education, but she also knew how to find resources to keep her family healthy. So, but I also agree that we also need to get people of color into the clinical trials so that we can be assured that the issues of race and ethnicity, as well as age, are in the mix when assessing the efficacy of the vaccines. And I'm with Dr. Lewis again. I'm a little bit skeptical, but I also understand Dr. Wright, you know, talking about the appropriate vetting. And again, if we get the politics out of the science, I think we'll be in good shape. So, but the public needs to have confidence in what's coming.
Yeah,
So,
no, it's great.
You're raising an interesting dynamic, because there have been those people over the years who would routinely accept vaccines. And because of the undue pressure around these current vaccine developments, those people are becoming hesitant to take vaccines. Mm-hmm. Meanwhile, there were people who would not take the regular vaccines because of whatever their perceptions were about vaccines, we are unsure where they are now, whether they'll actually take a vaccine if it's developed in this environment. So that's the kind of pressure society is facing. And that's why, again, I believe the authorities, the FDA, the NIH, state governments have to make sure that they're transparent, you know, the data is reviewed, and that all steps are appropriately applied to get confidence in the public accepting the safety of these vaccines.
Yeah, you know, Dr. Wright, you said one word that I was looking to key in on, and that is transparency. I think transparency is the key, and I think that acknowledgement of the history that really many groups have faced as it pertains that have led to mistrust that are ingrained there. And so it boils down to transparency, and it boils down to relationships with your provider. As Dr. Gomez mentioned in terms of searching for her mother, is that if we don't have individuals that we trust, that we have a relationship with in terms of providers who we know are looking out for our best good. And that's been demonstrated in multiple studies looking at people of color who tend to resonate with individuals who perhaps look like them or similar genders, and more inclined to have preventative strategies implemented, as well as vaccinations. It becomes important. And this is a major topic. You know, we're looking at our kids interacting in multi-generational homes, and the issue as it pertains to schools. You know, our kids in schools, do we shut them down? Do we open them back up? How do folks deal with work and that balance that's there? And so what advice do you have, you know, in this context of COVID, in the context of vaccinations, in the context of all this stuff, to parents and students?
Well, I guess I'll go ahead and start.
All right.
As an educator and administrator for the health science programs in a community college, we try to keep our students and faculty safe, and that's been a huge challenge. And I guess the one thing about a community college, and I guess that's why I tend to focus in on, you know, having care providers of color and that they reflect the community. And the community colleges is the great equalizer in that respect, is that we can train nurses and rad techs and other folks that do reflect the community. We lost most of our clinical sites back in March because the hospitals did not want to take the chance of having a student in the mix. Plus there was the initial PPE shortages. I often tell people the one good thing about this COVID situation is I no longer have to explain what PPE is, but everybody knows that now. But you know, most teachers want to get back with their students, and there's been some information out there that children do not get as sick as adults, but there's plenty of adults that have to be on campus with the children. the custodians, the teachers, the support staff, bus drivers, all of them have to interact with the children. And most students, the younger students, will follow the rules that are set out by the schools, wearing masks, washing their hands, keeping their distance. A lot of schools have opened in the hybrid mode or keep students in smaller groups. And honestly, it's okay for parents to ask questions and feel comfortable with what the child's school's options are. At the community college level or at the university level, we have adult learners or young people who feel that they're invincible. And we have to make sure that students understand the large gatherings and that it creates a risk for themselves, their classmates, and their teachers. I don't know about you, but you know, when I saw the students on the field at the Notre Dame Clemson game, I just went bonkers. First of all, why did they have that many students in the stands? And then to have them rush the field. So it's those kinds of things that you have to look at what's going to happen rather than, you know, thinking, oh, that won't happen at all, because it will. You've got young people. So it was kind of a wake up call for all of us when we all went home in the education realm. But we have to stay vigilant, you know, wearing masks, keeping our distance, that kind of thing. So, but ask questions of your schools.
Good, very good.
So my approach to this would be threefold, I think. One is we have to look at the health risk for the family. We have to look at the economic implications for the family. And then we have to look at who are the decision makers in the family. So health risk is going to revolve mainly around the elders with multiple medical conditions, diabetes, hypertension, and so on. So I think they have a greater weight in terms of what happens in that family. Do the children go to school or not? If they don't go to school, then how are we going to get help? Are we going to reach out to our church to help with tutoring or community groups to help with tutoring? But the health of the seniors in the family, who are the breadwinners, I think are going to have a big part to play in that decision. So it's their health and then their economy. Now I'm a physician and I'm fortunate to be able to work during this pandemic, but I look at so many people who I normally give business to, like dry cleaners or other people, shoe shiners, they are out of work. And so when they're making these decisions, they're going to say, is it easier for me to survive or to die from COVID? Because if I don't have economic survival, I'm just as good as dead from COVID. So all those factors have to come into play. And that's why I said earlier that people have to talk about what it is they want for their family. And if they die, what do they want to happen? And so make a will. So I think those elements are crucial to their decision making. And then the final thing I think is what's the level of COVID penetrance in their community? If the level of COVID penetrance is low, the risk of exposure is going to be similarly low. But the level of exposure is very high. There's every chance that a lot of members in that community are going to be exposed without knowing this. So again, weighing your economic situation, the disease burden in your community, and your health risk have to weigh into what to do. Do you go back to school? Do you go back to work? Do you homeschool? And I'm not sure I can make that decision for any particular family.
Great points.
So I just want to say that if we're going to be perfectly honest, those are choices that some families don't get to make because someone has decided that they're essential workers and they're going to have to show up for work. That's a non-negotiable. I'm at USC, and USC is not just rich students, it's also first generation students. And so having students who have basically had to go back home and who are now the primary breadwinner for their family, and they're supposed to be fully engaged in a learning community is a tough assignment. And so there has to be an appreciation for, we can't have a business as usual mindset in this environment. And that's what I find so frustrating, that people want us to be fully present and productive as we've always been, when we got all of these additional weights, these never events that are, on us day in and day out. And so I think it's critical that if we're going to tell people we're going to put them in environments that we can't fully control, that we're honest about that. And at least if we can give people a choice, give them the choice. At USC, again, we're saying we're not going to do anything until the county health department says we can come back together, because again, that is what we think is a reasonable response. And again, something that we can hold ourselves accountable to. But I think it's also important to recognize that part of that process was asking faculty and students, what do they want? And so for those folks who were okay with coming back to campus, they were, if we ever get to the point where we can rank people, they will be the first ones to go back. And so recognize where there's a chance to give people a choice, they should have those choices, but also recognize that when we don't have the luxury of giving people those choices, we need to find a way to support them better. I mean, students shouldn't be failing because we can't get the technology right. There's something wrong with continuing to disadvantage students.
Mm-hmm. Very good, thank you. Dr. Lowe.
My thoughts on it are that parents have to continue to educate and talk with their students in the home about how to prevent COVID-19, the hand washing, the hand sanitizing, the wearing the mask, and just continue to talk to them. But this is just a struggle for all of us, for our frontline nurses, for all the employees who are on the healthcare scene, making decisions like Dr. Lewis said, we don't have a choice. We have to be there. And so how do we protect ourselves? Do we have enough PPE to do what we need to do? So we just have to stay on top of the information and then follow the guidelines.
Got it. Thank you. Thank you.
I wanted to just add one other thing. So in Tennessee, the governor passed an edict that said healthcare delivery systems could not be sued. Workers were exposed around this time of the pandemic. So it's important that in the future we push for health policy, for public policies that will not only support employers' protection, but the protection of families. If a family member knew they had life insurance when they are being forced to go back to work, that would give them a little less worry, even though they would still be worried. But at least they would know there's some economic benefit for my family when I die trying to support my society. But here it's just the businesses that are protected, not the people who are being exposed by being forced to come to work because they have no choice. So you asked about families, but I think families have to understand that their engagement in the political process also impacts decisions that are made around what protections are then put in place for them.
Yeah, along the lines of public policy, on the lines of large gatherings, on the lines of choice, I think it's a perfect transition to the choice that we do have. And so right now we're on the cusp of the holidays, Thanksgiving, Christmas, New Year's, Hanukkah, various holidays that are out there, and many are seeking to embrace their traditions that they've had. And part of the grief that's happened in 2020 is this loss of tradition, this loss of culture and the things that they've been able to engage with, and this fatigue of the process. So the question to you panelists, the last question as we approach our time coming to an end is, how should we handle holiday gatherings in these unprecedented times?
Well, I'll go first and I'll tell you how I'm handling it. This is not a normal holiday season. We recognize that this is a challenging time. So what I'm doing is staying home, staying in, and just my husband and I are having Thanksgiving. And we'll call people if you can Zoom or Skype or anything like that. We're using the internet more, then we'll do that. But this is just not a normal season, and we just have to accept that that's how it is.
Appreciate that.
So my family has been used to coming over every other weekend during this pandemic, and we practiced social distancing, wearing masks, and so on. Family members have called me and said, "You're an infectious disease doc, what are you suggesting?" So one of my relatives, their child wants to come home from college. The child says, well, here's what I'll do. I'll go into quarantine where I am for 10 days before I come home. The day I get home, I will get a PCR test. I'll stay out until that result becomes available before I come into the house. So there are ways people can work to mitigate some of this forced separation, but it takes a lot of thought and a lot of planning. The child doesn't want to expose the parents. The parents don't want to be exposed, but this love is overpowering the desire to be together. And so we have to find ways to look at each unique challenge and then overcome this forced separation.
I think that's just a challenge for families in general, that we all want to be together, but it's going to be very difficult. I've only seen one of my sons once for one day since January, because he's a paramedic and he does not want to expose his family, even though he's done very well. But we also think he got the virus back in January, based on what he encountered, because we weren't being as careful back then, and knowing the things that we know now. But I will not see my extended family. I haven't seen my brothers and sisters since January or February, I think. And we're all, we want to be together. So we're going to have a Zoom call at a particular time, and that's how we're going to celebrate. But I'm one of the things that we do on our campus is actually I'm writing kind of an advisory to our students, because again, we want to keep them from going to large gatherings and then coming back for finals and then exposing their classmates and their faculty members. And, it's just and again, many people live in multi-generational families, and some people don't have choices. Like some of the other panelists said, people don't have choices. Their parents have to work. They're essential workers. They have to work at the grocery store, or they're a frontline worker. It's challenging. So I just think now let's be good to each other at Thanksgiving, so maybe we can have a better Christmas or better holidays going forward. But this is going to be difficult.
Dr. Lewis, any thoughts? Last thoughts?
So I'm in the middle, in the sense that we've been having a lot of conversations, and people talk about the rights to wear a mask or not wear a mask, but it's also about what's socially responsible. And where I am right now is that I want to protect the people that I love, and I want to protect myself. And so I am 60 years old and have never spent Christmas away from my family in Oklahoma, but I'm doing it this year because I just can't come from this hot spot and fly on a plane, and then who knows what's going to happen. And so I will admit that I won't be doing all the things that Dr. Wright talked about in order for me to see my family, but I'm going to show love and say, look, when it's better, I guarantee I'll do everything to get there, but it's just too risky. And since I don't know who is willing to accept that risk, I'm going to kind of hang back on this one.
Mm-hmm. Listen, I appreciate each and every one of you for joining in on this panel and lending your professional thought and insight into this. It's been powerful, really, in terms of highlighting the importance of the role and relationship with our providers and seeking them out, not being afraid to seek them out, for transparency, for the issues as it relates to really truly trying to engage inside this pandemic. I think Dr. Lowe really truly has highlighted inside the panel discussion. She said, let's work through these challenges and keep the faith that things will get better. We have to establish these relationships and move forward. So thank you to the panelists. I want to thank you to the speakers, Drs. Will and Ubani and Henderson and so forth, as well as our special guest, Lamman Rucker, for sharing the important knowledge today. It's been powerful. These programs like this do not happen without dedication and work of staff and volunteers. We know there's a lot of stuff that's happening behind the scenes. Those of you out there have no idea the amount of conversations that have happened, from Cassandra McCullough to Catrice K. Phelps. It's been phenomenal. Yvette Lee, Alan Merritt, I mean, he's been great in communication. We have our partners with Adam Porter, Donzel Johnson, Shelley Henderson, Dr. Underwood, the chair of the ABC Community Programs Committee, as well as Edwards Life Science, Amgen and AstraZeneca. It's been phenomenal. I think programs like this are the way in which we can enact change through education and empowerment and letting folks know that there is another way that we can go about it. I want to remember to let all of you out there know that I hope you've enjoyed today's symposium. You're going to receive an evaluation via email in this upcoming week, and we want to continue to provide you with the information that you need and the information that will impact you for a better health outcome that you're in need of, that you desire and that you deserve. And so I want you to take time to complete the survey. Don't just ignore, don't click delete, but to complete that survey. This helps us with future programming and planning. So I'm going to ask Lamman if he'd like to come back on and offer some comments and close out this great event.
All right, thank you so much, Dr. Batiste. Back, everybody. Hi, how you doing? Thanks so much for, again, having me here with you at such a critical time, and more importantly, at such a wonderful event. So, you know, I love this because not only do I get to be an added asset, if you will, to this work and to this message, but I learned so much. I'm almost starting to feel guilty that this is such a learning opportunity for me, and it's such privileged access, but it really illuminates just how important all of you are to making sure that other people have the same access to this information, to quality care, to being aware of who all of you are, the services and specializations that you have, and knowing in particular how great and how phenomenal ABC is. So I yell you all's name. I speak about this organization from the highest mountains, and always speak very, very highly of you. And like I said, I'm honored to be a part of this community and to be aligned with you as I've been over the years. You know, prevention and reduction of cardiovascular disease, or, you know, health equity, improving health disparity in general, and improving the health of all people has always been a part of what this messaging has been about. But I realize it's actually been a part of my life, period. So this has always been really just perfect alignment. So I want to thank everybody for attending today, whether you've been a presenter or a panelist. Thank you again to our gracious hosts, and all of the leadership throughout ABC and throughout ABC's history from the very beginning, as well as since I've been a part of it. Thank you all so much for continuing to embrace me, embrace my family. Unfortunately, you know, stroke and heart disease and high blood pressure and diabetes has definitely been a significant issue throughout the history of my own family. You know, even Shaq and I talking last year realized that our sons, my godson and his son, actually have the same heart condition. So many of us have been touched very, very directly and very recently by issues of heart disease. I've got other, you know, people throughout my family, other generations, and even other sides of the family and extended family. So this really does hit close to home for me as well. And again, it means a lot to me to be part of the solution, to be involved again in the prevention, but also in the healing and in the response to crisis, and in response to some of the critical issues and critical conditions of many. So again, I always feel very informed and very well equipped to respond and to educate and to also advocate for this work, for ABC, and for heart health and overall wellness for us as individuals, as families, and throughout our community. So thank you so much for all of you interested in membership. Please know that you can go to abcardio.org to learn more about the organization. There are other helpful resources there on the website as well. And you can fill out an application actually online for membership. So, you know, without reiterating or being redundant and saying all the incredible things that have already been said. I think there's so much to walk, as I see someone's comment, there's so much to walk away with today. And there's always more. So please continue to be part of this community. Please stay in this conversation. Please tell others about ABC and all of its friends and partners. And I look forward to the next time I have to be with you, to serve you, and to serve alongside you. So I believe this completes our program, but I want to say, again, thank you again. Have a great night. Have an incredible weekend. Enjoy your holidays. Thank you so much for your love and support of me and my career and my work on and off camera. I'll see you December 15th on OWN. Cooking Up Christmas is my holiday film. So if I don't see you any sooner, I'll see you back on the boob tube, as they say. And we'll be able to enjoy some holiday cheer virtually in that regard. So enjoy your families, however modified that may be. Please be safe, be smart, stay informed, stay engaged, stay committed, and stay involved and continue to fight the good fight. Thank you everybody for attending this community forum and wellness symposium. It's been a wonderful opportunity to be by your side. So I will look forward to the next time. And until then, peace, love, and continue to do everything you do with the spirit of the heart.